Okay. Good morning, everyone. Welcome. Welcome to this consultation jointly organized by YUVA and UNICEF, Maharashtra, on the convergence of social protection in Maharashtra. Thank you all for joining on time and especially for your attention and investment in discussing this very, very important topic, which I think is dear to all of our hearts and our work as well. We all know that social protection is a globally important conversation that's happening right now. The ILO is reporting that only 29% people around the world actually have comprehensive social protection, which is quite a stark figure, which means that more than 5.2 billion people are only partially covered. And we know that all of us in India fall into that, that group. And within these stark figures, we had the pandemic, which brought social protection to the forefront like no other time before, and I think more than 150 million additional people are living in poverty. And that's just the World Bank's official figures. Recently, Oxfam put out its inequality report in India, and those are also very, very stark figures. Basically, so in countries like India, there is this new poor that, have come about because of the pandemic. And I think these numbers have become so much larger. So while social protection was always an important conversation, I think post the pandemic, three main things have been really highlighted. The need to really revisit our entire understanding of social protection and expand that understanding beyond, just target populations, or really reassess the implementation of what we have, as well as the accessibility of the most vulnerable, whose number is only increasing. I think that's a big, important takeaway for us. And another important point has been the need to shift from the immediate short-term, short-term temporary relief measures that a lot of times social protection does, to really looking at long-term resilience focused social protection. I think that's another important shift the pandemic has brought to light. And then I think another important realization has been the acknowledgement of this critical value add that civil society provides in ensuring social protection reaches the last mile connectivity, the actual facilitation of entitlements, focused awareness, demand, as well as advocacy, and holding the state accountable to whatever has been, put out. So I think these are very, very important, the context within which this conversation today, is happening. And there is this urgent need to focus on universal social protection that is holistic, comprehensive, and reaching, the last mile. But research and practice constantly highlight several gaps in the existing social protection ecosystem. There are concerns, there are also challenges, all of which need to be addressed in case we need to actually create, a holistic social protection system for the most vulnerable groups, including women and children. Low investments by the state also is a big part of the, the story, as well as poor implementation. The studies and the work by civil society groups also are showing data gaps which exist, and there's also a lot of clear indication that civil society groups have to really converge, particularly our advocacy efforts. And there are also challenges we see in the interface between civil society groups and the systems. For instance, in Maharashtra, there were several pandemic relief-based social protection which have been announced, but at the same time, civil society groups have been demanding for a much more holistic social protection. So, but some of these demands end up being piecemeal. So clearly, there is a mismatch between what is being provided as well as what is being implemented on the ground, and all the advocacy that is being done in this space as well. There are ecosystem challenges here. And I think, many of us have been having these conversations, particularly over the last 1 year in different forums. And we felt a very strong need to create space for a dialogue as a first step to coalesce all these different efforts and really bring them together in a strong and a focused way. And I think that's really what has brought us here today, looking at starting this dialogue, moving into action, of course, and perhaps taking the form of a platform of diverse stakeholders, civil society groups, movements, collectives, academicians, as well as interested, the systems who are engaging in the social protection concerns in Maharashtra, and trying to position this platform as an expert and informed voice to not only helping the design, but also identifying, evaluating, and improving, policy and program issues. I think that's something that many of us have been feeling. And even when we were having conversations about this consultation, we heard a lot of, coherence with many of you in that point. So today's meeting really, is being planned as a first level platform meeting of this, of all these stakeholders to understand the existing social protection landscape and address the identified gaps and, other emergent challenges. Specifically, the objectives that we have for today are really looking at unpacking the social protection landscape and the recommendation that a lot of evidence has already generated, both through policy and practice. Then we also want to spend some time understanding civil society work, the strategies that have already been used to address many of these gaps. That's another important point which we think needs to be addressed. And then finally, start discussing how can we synergize our efforts between both people and systems towards building, much more strategic sort of a advocacy push and really move towards transforming the social protection landscape in Maharashtra. And we feel that the time is ripe, not just because of the pandemic, but also the current political and social context that we're in. I think, there is no time better than now to really start having this conversation. We do hope today will be the start of this conversation, and, efforts will be synergized to really implement the entire life cycle approach, but also looking at social protection in a much more comprehensive and, holistic way, both on the ground, but also at the policy level. So once again, I want to thank you all, for joining us today. And we're really looking forward to this. We had hoped to do this offline, but then due to several considerations, we felt at the first meeting, we will meet with all of you online, and then we will hopefully have many opportunities to meet in a much more deeper way physically. I'll just quickly go through the agenda, if we can just go. So today we have divided the day thus. We will have the first session on research findings which have been done. Several researches have been done over the last 18 months, which are quite important and path-breaking. So all of these studies have had their own launch event. So it's not going to be a detailed research finding presentation, but more in terms of what are the big takeaways and linkages with the larger ecosystem. We will then move on to the strategies section, using the evidence that we have heard. What are the strategies that civil society groups have really worked on and movements? And we have a very exciting group of speakers there, starting also with the UNICEF perspective, but also several other Maharashtra groups and networks. And then post that, we will have time for really discussing the way forward in terms of how do we come together and what are the actions that we can perhaps start taking to move beyond all the evidence and the experiences that we have into actual actionables, and what are the possibilities for us to take action. So that's the brief way in which we've arranged the day. I will be your anchor for the day, and I'm happy to move into the first session. We do have the hosts and the co-hosts who you can message in case you have any technical issues. There's a person called YUVA IT. So if you have any technical concerns, please do feel free to message them. Yeah, we can move on. Next. Okay, so the first session, we have three very full, it's a women-led session, so I'm really excited about that. We have Mukta Nayak, who is a fellow at the Center for Policy Research, and she's an architect and urban planner and has done lots of work on migration, housing, and very close connections, working with the state, with the Niti Aayog. So we're really, really excited to have you here, Mukta, and she will be speaking about a study that CPR did with UNICEF over the last year on portability and, for migrants. So thank you for being here, Mukta. We also have Avni from the RCUES AILSG. She is representing AILSG. The ED of AILSG, Utkarsha, was very keen to be here despite her maternity leave, but unfortunately she had a health condition and she couldn't join us today. But thank you, Avni, for joining. Avni is a research associate with AILSG, and she has been associated with a current study that they have done over the last year on looking at urban social protection in the state of Maharashtra. Welcome, Avni. Then I'm also happy to introduce Marina, who is my colleague here at YUVA. She's also been working on issues of urbanization, particularly labor and habitat, for the past several years. And Marina will talk about a study that we have done on the relief packages announced by the state of Maharashtra over the entire COVID time period. So again, very, very excited to have you all. It's a very powerful panel. Welcome. And I will also introduce Rajeshwari, who is the Chief of Field Office in Maharashtra. Thank you, Rajeshwari, for always being, the backbone of support for a lot of the work that many of us are doing. Rajeshwari, once the panelists speak, Rajeshwari will open up the floor for discussion as well as add her insights based on her very vast experience over the last several years in the state. So welcome to all the panelists, and I will now hand over to Mukta for beginning.
Thank you so much, Rashni. I'll just share my presentation in a minute, and then we can.
Yes, we can see.
All right. So I'm speaking here from basically from a study, and you can see the cover of the study on the left side of the screen that we did with UNICEF last year, which actually spanned through the pandemic. And a lot of this is a qualitative study, and Maharashtra was one of 5 states that we examined through telephonic interviews with CSOs, government functionaries, experts, etc. So right at the outset, I'd say that as as CPR, we're a New Delhi-based organization. So I'll admit that we have a very Delhi perspective on a lot of things. And we were just chatting before the session started that that's sometimes a good thing and sometimes not such a good thing. So I'm here to speak, but mostly to learn. I'm really excited about the second session that both the speakers who follow me as well as the session after this, where I think the meat of the conversation would be. I'm speaking both from the study as well as from a webinar that we co-organized with Niti Aayog and UNICEF India on this issue. And the focus of our study was looking at migrant children and women and portability of social protection. So just to start with, as I said, the Delhi people always start with the big picture. What I've really, these are just some reflections on where we are, and the note for this consultation also started with this juncture where we stand as the pandemic has sort of ravaged us, and we are trying to reevaluate a lot of stuff. For me as a migrant researcher, it's become very evident to me that migrant as a category is very poorly understood by all of our stakeholders. And this is not an accusation towards one kind of stakeholder. I think collectively we have to own that this is a problem. Sometimes we congeal the word migrant with the unorganized worker, sometimes it's the urban poor, sometimes it's the homeless, and these are all categories that intermingle in a vague way, and we can't sometimes understand how exactly to target the fact that mobility in itself could be the source of vulnerability. So I think in my work, the things that I try to understand is that if there is a vulnerability, then is that on account of the person's poverty, lack of literacy, location, that they are not where they are from, so what exactly is the cause of that vulnerability? So sometimes it's about disaggregating that. So the specific vulnerabilities could be because of invisibility in data, which Roshni already mentioned, to where migrants are located spatially in areas where the state apparatus or doesn't really have a very good vision on or a very good handle on, or because they are at the bottom of segmented labor markets where the formal employment data does not capture them, and we know the problems with the migrant labor side of things, or because they fall out of the safety nets and service delivery frameworks, which is what we are talking about today. And this could be because they are interstate migrants, or simply because they don't have the right identity requirements to keep within the system. The labor-centric discourse on migration, which does not really take into account a lifestyle approach and sort of privileges economic rights, also means that migrants find themselves particularly disadvantaged. We know that the voice of labor is weak at this point. Migrants are marginalized even within unions and collectives. And so they have a problem with accessing their economic rights, and political and social rights are not really at the center of the migration discourse, because it is a very labor-centric discourse with the Ministry of Labor and Employment and labor departments sort of the nodal agencies for looking at migration. So although during the pandemic we've realized this, I'm not sure whether we're at the point where we know what to do with this disconnect. So that's also something from the top level that I would like to bring to the table. Coming to the study itself, I'll sort of go through the findings and a few recommendations and try to pull in what we heard from our respondents in Maharashtra. So broadly, we have these contrasting logics of universalization, which is countered then with all these eligibility dynamics. That could be domicile, that could be identity, that could be various kinds of cutoff, logics. The central schemes may have a very inclusive impulse when it comes to migrants, but the execution can vary across states. And women and children find themselves particularly peripheral in this labor-centric framing. Women are not visible even in labor data, in employment data. They're seen as marriage migrants, as follower migrants. Children are not, the diversity of how children are impacted by migration, whether they're accompanying parents, whether they're left behind, and whether they're migrating independently, which working at UNICEF, YUVA, people who've been working with these particular segments of society are now very well aware of. That sort of language is yet to really find itself into mainstream policy discourse. The fourth point is that the rural-urban axis is a segregator axis when it comes. The governance differences between rural and urban really impact scheme delivery. And this we've seen because, we've seen it very, very clearly during the crisis with migrants returning and moving away from urban areas. But what do we do about it? Because we know that there is an enduring problem of capacity and weak governance in cities, and that is also then down the line impacting migrants. But yes, the safe migration as a way to look at policy is something that now is much more on the radar, and everybody, there is a point of agreement, and I couldn't agree more with Roshni that there is definitely, we are at a juncture where there's a lot more alignment than we've had before. So the main takeaway from the study was this gap between design and intent of schemes and their delivery. And for universal rights-based entitlements, especially for the case of migrants, we found that there was an inclusion by assumption. So right from the highest level to the lowest level, there is this assumption that if it's universal, then everybody is going to get it anyway. So, what's the problem? So it's always very difficult to have a conversation about right to education or health because it's assumed to be universal. And those of us who work on the field or have any interaction in the field know that that's far from the reality, because the scheme design itself doesn't factor in on-ground realities which result from migrant exclusion. So this could be something like the split household. Some parts of members of the household are in one location, other members are in another. Migrants may not be aware that schemes have provisions for split households at all, so they are assuming that they can only access the scheme at source. Circular mobilities result in interrupted education, with children being pushed into labor, and remote locations of work where there isn't infrastructure for delivery. So the scheme design doesn't often speak to these realities. And of course, the problem of incomplete data sets where migrants are seasonal and circular migrants, women and children may be invisibilized, is an enduring problem. Eligibility and identification, migrants always bear the repeated burden of establishing themselves as beneficiaries if they are circular and seasonal, if their migration is circular and seasonal in nature. And they're also poorly represented by collectives that, there's no one to speak for them, really. And we know that the new labor codes, which are still, the rules are still under formulation, poor implementation of existing labor laws, all of that compounds this problem. So the process of registration of migrants into schemes is weak. And I'm not sure that a very top-down approach, which is, is helping really. And at least from whatever I know, and I'm sure civil society on this call can speak more to it, it seems to be a replication of the errors in every subsequent effort that is made to correct this problem. So something needs to give in this particular space. We can illustrate this particular example where something is universal in concept but not really implemented through the problem of the RTE and the Samagri Shiksha Abhiyan having a bunch of scheme provisions for migrants, but the disruption of school enrollment still being the actual lived reality. I won't go into the details. There have been many good practices to bridge this gap in the past, which some of which are study captured, and I'm sure other states have also done great work on this. And similarly in health also, there is a continued exclusion, partly because they are not enrolled, the lists are not updated, but partly because migrants are themselves not aware of what they can access and how on entitlements that they otherwise would have easily accessed in their source areas. So I'll come to the recommendations quickly because I know that there are two more speakers after me. So the first one is this fragmented and incomplete understanding across tiers of government, so center, state, local, as well as among and within state level departments, requires some sort of an intervention where the idea of migration itself needs to be mainstreamed. This was for me a really, I should not have been surprised, but it still did surprise me when we did the study, because we did it in the wake of the second wave, as state governments were really grappling. They had just finished dealing with the migrant exodus, and then they were grappling with the second wave where, there were fault lines across health and across food security, etc., emerging. And still there were departments which we thought were essential to the response that were not fully aware of the entire migration, ecosystem and realities. The second, I think, is something that there could be a lot more discussion on, which is just institutionalizing and scaling things that have already worked. So in Maharashtra, whether it's the education guarantee card or the kinship care model, or a larger outreach of the MCP cards, or whether it's language facilitation for interstate migrant schools, which some other states have tried, or in particular, or whether it's expanding a hostel program that works in certain sector to other sectors, etc. So, I mean, this is a longer conversation. These are just some examples from our study, but this is something that should be looked at. The third is deepening engagements of the Labor Department or any other nodal departments that the state government considers at local levels. And again, I think post the pandemic, a lot of states are looking at this, labor centers, all sorts of panchayat level initiatives, but I'm not sure how much, my sense is that momentum could also be getting lost as the pandemic wanes and as the focus on migrants particularly wanes. And I'm not talking about Maharashtra specifically when I say here, but this is something to remember. Next is addressing, which is very close to my heart because I come from an urban planning background, the capacity and fragmented delivery in urban and peri-urban areas, especially peri-urban areas where a lot of migrants work and live. And, we can see how, like, for example, ICDS and primary health could be disconnected in terms of who is actually delivering these programs. And this is a specific case in Maharashtra, which I think there is already some movement on addressing. Similarly, infrastructure at remote work sites or PDS access to migrants in homeless shelters. These were things that came up during our interactions. So I'm sort of citing these directly from the interviews that we had. Then the whole enumeration and coverage of migrants in many kind of scheme databases. I think here there's an sensitization issue, a training issue, a capacity issue, but also, and this may not be the politically correct thing to say, but also an intent issue. Do we really want to do this? And if we want to do this, then how to do it is perhaps a less insurmountable problem. Addressing awareness among beneficiaries really came very high and very often in our interactions, that even, when there are health schemes that are available, for example, the Mahatma Jyotiba Phule scheme in Maharashtra, or specific funds for poor, there was an indigent patients fund, things like this, migrants had no clue about these things. And I'm talking even about intrastate migrants. Even though our study did end up capturing a lot of rhetoric on interstate migrants because of the timing of the study itself. Collaborative mechanisms, which is a big agenda on today's call. Here again, the learnings really were that which are the nodal agencies which could do this? Who will do this collaborative, bringing all these different actors together? Will it be the government? Will it happen in a more neutral space? And how do we involve employers? Those were the sort of big concerns that came out. Yeah, and I'll stop there because I want to learn from Marina and Avni. Yeah, thanks.
Thank you so much, Mukta, for very sharp and insightful presentation. And I think you also kept within the time, and it's a good overview. Thanks so much. I'll request Avni to come on. And Avni, can you share your slides, please? We've given you access.
Yeah, is it visible?
We can see. Yes, go ahead.
Yeah, so good morning, everyone. I am really delighted by the presentation that I saw before me, Mukta ma'am's presentation. I think it talks about a lot of things that we are also going to address through our study here. So I'll be discussing exploring urban governance and social protection in the light of COVID-19 in Mumbai, a study that we conducted in collaboration with UNICEF. Like Mukta ma'am said, yes, this study was also conducted in the wake of the second wave of the pandemic. We've tried to capture the field reality through that pandemic and how social protection was a requirement, or how we woke up to the need of a better social protection during that time. To start with, the aim of the study was to understand the role of MCGM in managing the COVID-19 pandemic and map the urban social protection schemes to understand the coverage within the city. Then also how much the existing coverage of the city of the USPA schemes is through a life cycle approach, and come up with some preliminary policy recommendations. The second objective was to understand MCGM's role in an administrative elected representatives' role in delivering the services to vulnerable communities during the pandemic. And finally, documenting some noteworthy initiatives that came up during the pandemic management. Coming to the approach and methodology. So the study was conducted in 3 stages, where we started with the primary and secondary data collection by categorizing the schemes and mapping their implementational modalities, and conducting and strengthening the secondary data with primary data through KIIs and FGDs with beneficiaries and officials and NGOs. And then finally, documenting the response of MCGM to COVID-19 and recommendations on how these findings can be incorporated. Through the stakeholder interactions, since AILST has a lot of collaboration with ULBs, we also got a response or perspective from the ULBs through numerous interactions with state and MCGM officials, NGOs, and also field workers, beneficiaries and also non-beneficiaries. So the study was conducted in 9 departments and 33 plus USPS were discussed and studied. This is an overview of the schemes that we studied. Moving on to the final output came into two parts. Part 1 was the study on schemes and the coverage and the findings. The second part is response of Municipal Corporation of Greater Mumbai to the COVID-19 pandemic. Coming to the overall observations on USPS, RTE Act or the NFSA is a welcome movement towards right-based approach. Since the country doesn't have a very strong or mature social protection in terms of social protection social floor or ladder, I think RTE and NFSA was a very welcome movement to prosper the rights-based approach in SPS. In Mumbai, USPS edifice is very, very extensive. So there are legacy programs like ICDS, TPDS, or MDM, and they have had a history, and they have been long-running programs, and have undergone a lot of revision and improvements. They have an institutional memory, and hence the outreach or their delivery modality is really, really strong. The target group knows about or is aware about these schemes. That also assures a lot of inclusion. And then there are also newly launched NUHM and NULM missions. These have really, really comprehensive goals. For example, NUHM talks about the convergence or KPIs, SOPs, or quality measurements, and all of this scopes to empower and mainstream marginalized. But with that, there are other schemes at the end of the spectrum which need to be redesigned or realigned with the field realities. So some state-run schemes like Maji Kanya Bhagyashree or a central scheme like CREST scheme, these need to go back to the drawing board and need to be rethought and redesigned. Then there is an observation that there are certain schemes that get prominence over others, or others get relegated in the background, and so PMMVY or schemes that are new or run by the central government get a little bit of prominence, and the others do not get that much of a footage. And this inhibits accessibility and coverage for deserving beneficiaries. There is definitely a silo approach because there are parallel systems, and there is target similarity, or there is inclusion criteria similarity, but the procedure is different. So all of this, and so this causes multiplicity, and since there is no inter-organizational coordination, this causes a lot of confusion as to in terms of responsibilities or potentials and harmonization, and in all weakens the accountability. It does not keep the system transparent, but it creates a sort of an opaque system to work with. Coming to also majority of schemes, as discussed, that have human resources deficits. There's infrastructural deficit, there's human resource deficit, and all of this weakens how smooth the scheme can function or how smooth the program can go. Then also observed were budget inconsistencies in bigger departments like WCD run schemes or NULM. They have indicated fluctuations, and this in all impacts how a program is implemented, continued, and how it performs. Then there's also observed that the NGOs who also helped us connect with the field workers or beneficiaries, they are not a formal part of the delivery modality. So there is no formal adoption of NGOs being a part of the delivery modality, while they are doing a lot of work on ground. Also, macro and micro level evidence building needs to loop back to program frameworks, because those observations strengthen how a program can be improved further. Digitalization, however, is a welcome move or is a positive thing, but still it is in its nascent stages and has fundamental or foundational problems. So recording systems or reporting are digitized for many programs, but then there is no consolidated MIS system. Hence, oversight of multiple schemes is missing, or inter-scheme linkages cannot be observed. Hence, the targeting cannot be increased, or efficiency doesn't increase because of these fundamental issues. Then there is also an observed gap in supervision and inspections in terms of quality or even adequacy. So regular inspections are not in place and are done very, very sporadically. And this affects the quality or the implementation of the program. Also, third-party evaluations were not observed, or observed very, very sporadically. Social audits, if done, their results are not considered when the programs are planned further, or there is no decision influenced by a third-party evaluation or a social audit. Then also about the grievance redressal system, if we come to, there are a lot of grievance redressal portals for a lot of schemes and programs. But there is a mismatch in this case to the reality of the beneficiaries, as the schemes are targeted towards the vulnerable community, and it is a lot to expect from a slum-dwelling person to actually go to a website, look for a feature, post a grievance, or just upload or scan documents. So right now it needs to be more user-friendly, but at least the digitization process has begun, and that is a positive move. All of this is actually cumulatively resulting into last mile connectivity issues, where the people are not aware of how much they're entitled to, where they can go to, or what they should be doing to entitle themselves to a particular scheme. And this is actually because the ISE efforts are very, very undervalued. They're undertaken in spurts. They are very strong when the scheme is launched, the program is launched, and then they taper out as the program is established. So this results into a lot of unaware population not knowing as to what they are entitled to. Also, there is no official role for ERs who are directly connected to people who have good rapport in their constituencies, who can actually let people know or bridge the gap between them and the system. So there's no official role for them. So whatever they contribute is based on their personal qualities and rapport with the groups in their constituencies. And all of this is definitely leading to a lot of lack of information with the beneficiaries about schemes, and unawareness about their eligibility or entitlements, which defeats the purpose of a rights-based approach per se. To sum it up, all these above issues compromise the governance frameworks within which programs are planned and executed. So now we present our preliminary recommendations, which actually dovetail into how these dovetail into the findings of the study. So first is the rationalization of schemes. So a lot of schemes, like I had earlier mentioned, need to be redesigned, or they need to be conversed with the already existing schemes, or their design needs to be revisited to terminate duplicity and inefficiencies, and they need to be integrated to optimize resources. Then there needs to be a single window approach for a lot of scholarship schemes, which is also proposed in the education policy, national education policy. And there needs to be some redesigning and reorienting of the scholarship schemes as well, since they don't match the contemporary scene. There definitely needs to be some augmentation in the infrastructure and human resource factor. And there needs to be some transparency, adequacy, and consistency in the budgetary allocation, since that depicts a lot about how the program has been functioning in the timeline. M&E is a peripheral component right now and needs to be repositioned as a critical component within the programs. There needs to be an evidence-based approach which informs to have a meaningful decision making and have a strategic field level planning and implementation. There needs to be KPIs and SOPs so that we can have some benchmarks to creating benchmarks. Also, third-party evaluations and social audits need to be promoted for assessing program performance, as they can get us really important observations. Then creating a robust MIS system and social registries is also important. We actually collect a lot of data, and there is a huge database which is not utilized. If that is utilized, or we have a robust MIS system, we can have a consolidated beneficiary database that can have a large impact on how schemes have an outreach right now. Consistent and well-planned IEC efforts. This will ensure that the scheme doesn't fade out, or a similar scheme with a similar target audience or a similar sort of a background does not come again, or the earlier scheme doesn't fail. So there needs to be a consistent and well-planned IEC effort, and synergetic partnerships with a lot of active stakeholders in the arena. That can be community organizations that are working, or NGOs, so that an institutional response is there to increase coverage and inclusion. And finally, the ultimate goal of social protection system is not only to protect marginalized from life cycle shocks and risks, but also to integrate them into the larger formal frameworks. So if we discuss Mumbai and the study, I think Mumbai has a long way to go, improve and strengthen their social protection system. Thank you so much.
Thank you so much, Avni. Maybe stop sharing your screen. Yeah, okay. I think this really was a great segue from the way Mukta gave it a much broader perspective and really looked at the larger level in terms of design and what are the stated, where are the gaps between what is being said and what is being done, and really bringing it down to Mumbai and the urban context. I think which for Maharashtra, as one of the most urbanized states, it's very, very critical. So I'm really glad that both of you are echoing each other and bringing it down granularly as well. So thanks for being here. We'll move on to Marina, who will take it even more, I think, to exactly the COVID time and what happened during that time, especially in Maharashtra, and what are the learnings we get from that. I think will resonate with a lot that we've already heard, and also provide some more nuance, I think. So over to you, Marina.
Thank you, Ashwini. Okay, so my presentation today will actually draw from 3 studies that we have done in 2020 and 2021. The first study looked at the Mumbai metropolitan region, specifically looking at access to the Atmanirbhar Bharat Abhiyan, which was the relief package announced by the government of India during the first wave. The second study was a study we did with IGSSS, looking at social protection packages for informal workers announced by various state governments in the second wave. And then there's a study that we've done with UNICEF looking at the field verification of the government of Maharashtra's relief package. The reason I'm sort of taking out a few findings from all these studies is because with the first wave, we saw the government of India actively announce a relief package which grew completely on the social protection schemes that existed prior to the pandemic. With the second wave, the responsibility of announcing lockdowns as well as announcing social protection somehow passed on to state governments. And that's the wave in which we saw state governments announce their own relief packages and the government of India sort of take a backseat with regards to relief-based social protection. It's important to just note here that most matters relating to social protection are in the concurrent domain of the center, state, and local governments. And the need for social protection flaws and social protection has been highlighted through the pandemic. And it's imperative that various levels of governance respond to it. It's not just a center versus state sort of a debate, as well as a local. And I think the speakers, the presenters before me sort of highlighted how it's at all three levels. The focus of my presentation will be specifically looking at food security, cash transfers, and pensions, because these are existing, some of them were existing social protection schemes that were sort of expanded as a relief measure. So we look at how this was done and what were some of the challenges and gaps in this process. With regards to food security, a study that was published just last week, I think, by the Center for Equity Studies and the Right to Food campaign showed that 79% of Indian households across 14 states reported some form of food insecurity as late as 2021 December. Just going to show that the impact of the pandemic on food security has been rampant across the country. Specifically, if we look at the targeted public distribution system through which dry ration is provided to urban poor, not just urban poor households, just poor households across the country. The government of India through the PMGKY has announced an additional ration to BPL families. It was later expanded for APL families as well. In the second wave, the government of Maharashtra provided a 1-month relief package, again, a small relief amount that sort of topped up what the center was giving as their usual allocation, plus the PMGKY, plus this 1 month of additional ration that the government of Maharashtra provided, the state government provided. In terms of this, what happened, a couple of challenges that, of course, if you look at the fiscal outlay, it's quite high and the government has spent a lot of money on the TPDS, the relief provisions through the TPDS. But if you look at a couple of challenges, one was with these several announcements being made, both by the center, by the state government, many NFSA card holders admitted confusion about what the allocation was. There was a lot of, at the grassroots level, at the ration shop level, there was some sort of a non-communication with beneficiaries regarding how much they should get. And hence, there was not a lot of beneficiaries actually took home the amount that was to come to them from the state as well as from the PMGKY. So that awareness and communication regarding relief becomes extremely important. The other thing, of course, is the insufficiency of grain and nutrition inadequacy that we see. I won't go into that detail, but I think one thing to bring to light here is this issue of portability. In the 2020 study that we've conducted in the Mumbai metropolitan region, we found that out of more than 14,000 households, urban poor households, there were around 82% who were enrolled with the PDS who had NFSA cards. However, only 45% of them had these cards with them in the Mumbai metropolitan region, going to show that so many households have PDS access, but not necessarily where they stay. In 2021, when we did the study with UNICEF, we did the study across 4 districts, both urban and rural, 2 urban districts, 2 rural districts. We found that out of the 940 households that were surveyed, only 10 households, even a year later, reported accessing ration through the One Nation, One Ration scheme. Which itself shows that even a year later, after the One Nation, One Ration scheme took place, the entire migrant issue really, came to the fore. The actual implementation of the portability scheme has remained minimal and very dependent on intermediaries like NGOs, civil society organizations, etc. Another important point to make here is this Aadhaar linkage and the lack of residential proof becomes a tool for exclusion, especially to access something as basic as grains. When we look at the cooked food scheme that the government of Maharashtra developed, so the Shiv Bhojan Thali scheme, community kitchens have actually long been used to ensure food security, particularly addressing the needs of populations who aren't covered by the ration system. And the Shiv Bhojan Thali scheme was launched in 2020 to provide subsidized, wholesome cooked meals. And in the way, with the coming of the second wave, the scheme was expanded. The cost of each plate was reduced from 10 rupees to 5 rupees, and then later made free for a month. And around 13,500 urban centers, Shiv Bhojan Kendras, were opened across urban Maharashtra. And while this was definitely a welcome move, because there have been different states like Tamil Nadu, for example, that have very well-known cooked meal programs. This was the first. This was in the last couple of years. Of course, there has been a history in Maharashtra as well, but this was a new attempt by the government of Maharashtra. And over here, we found, when we spoke to people about accessing Shiv Bhojan Kendras, we found very few people having accessed it. Largely, these were because of locations. They had heard about it because the advertising for the scheme was, it was very well done, but the actual locations people didn't know about. People who had accessed it, however, were pleased with the quantity, the quality, and they said they were able to access it only because it was close to either their place of work or wherever they lived. So that, with regards to food security, these were a couple of issues that, that came up through all these studies. If we move on to cash transfers, so if we look at in 2020, there were just two kinds of cash transfers that were initiated through the Atmanirbhar Bharat Abhiyan. The first was looking at providing 500 per month for 3 months to women who had Jandan accounts, and as well as there was a mandate sent to all construction workers welfare boards across states, saying asking these state boards to provide cash transfers to construction workers, because of course the BOCW in different states have a well-funded welfare board. And so that was all that we saw in terms of cash transfers in the first wave. By the time the second wave came, there was an interesting trend that we found in the study that we did with IGSSS, where many state governments have started making cash transfers for informal workers. And even the government of Maharashtra, in fact, came up with a one-time cash transfer of 1,500 to 4 urban informal worker groups, of which 3 of these groups had a prior registration requisite. So only if they were registered earlier were they able to access this 1,500. For example, construction workers had to be registered in the Maharashtra BOCW. Domestic workers had to be registered in the Maharashtra Domestic Workers Welfare Board. Street vendors, of course, they don't have some of them who had a license or a survey pauti, or interestingly, there was the Swanidhi scheme that was again launched by the central government in 2020. If they had a document, a letter of recommendation that they had accessed the Swanidhi scheme or had applied for the Swanidhi scheme, then they were able to access this 1,500. So a lot of it actually depended on whether they had already registered at some point in the past, pre-pandemic, in a sense, because even to access the Swanidhi scheme, you had to be a vendor prior to the pandemic. An important point to note here was that auto drivers, permit holding auto drivers, of course, they have to be registered in the RTO and have licenses, etc. But this was a new application process for the government of Maharashtra. And this was actually fairly easily done, even though it was a new process. It was completely online. A lot of auto drivers actually accessed the scheme. However, one challenge was that because of this permit holders, of course, autos run on it's rented out through the day. 3 different auto drivers may use the same auto. In fact, 23% of the permit holders who we found were not even auto drivers who ended up accessing this 1,500. And while 97% of them were aware, just going to show how well the scheme did in terms of awareness, only 83% received the cash transfer. So I think one thing we need to highlight here is there is a possibility, even during the time of a pandemic, for a new relief scheme, when it is announced, for new registrations to happen. But of course, I'll come later to a couple of challenges there. Just another thing that I want to share here was that other than cash transfers for urban informal workers, there was also a cash transfer for BPL scheduled tribe households under the Khauti Anudan Yojana, where each registered family who was prior to 2000 registered in this Khauti Anudan Yojana scheme, they were entitled to 2,000 rupee cash benefit, as well as a diverse food kit, which also was quite interesting because that is a nutritionally secure food kit. So this was actually an interesting scheme, but of course it's limited to just a few families. A couple of challenges with regards to these cash transfers was that while awareness was high among most of these workers, receipt of benefits was relatively low. And as late as 23rd November 2021, in a news article, the State Transport Department has reported wanting to return 70 crore of what they had received as relief to be distributed to workers. This is especially stark given the fact that their application process was rather smooth, and they had a number of workers who had actually applied. However, the State Department was willing to give back that relief money, saying we don't have more applicants, we're not able to distribute this money. The same was for the Domestic Workers Welfare Board. There's a lot of delay in digitizing records. A lot of domestic workers who were registered prior to 2013-14 were not able to get this money. Of course, as late as January 2022, domestic workers are still getting this 1,500. Also going to show that our cash transfers, relief-based cash transfers, really about that time period, or at what time are you really giving this relief is quite important. And same for the Khauti Anudan Yojana. When we conducted the survey, even as late as August 21, a lot of families, scheduled tribe families, reported not having access this cash transfer at all. Probably at a later date they did access it, but not during the second wave. Just quickly going on to pensions. So there are 3 pension schemes, and although they come under the National Social Assistance Program, the state government also provides a sort of a top up to what the central government provides as pensions. But even these pension amounts are rather small. You have a central amount of say 200, and then the state tops up with 500. So it's depending on the scheme, they get around maybe, the disability pension will reach up to around 600 state and center allocation together. Say the old age pension is around 700 rupees. The widow pension scheme is between 1,000 to 2,000. It's a minimal amount. And the relief package in 2021 by the government of Maharashtra said that they would get a 1-month pension advance. Now, one is when you, as it is, pension receipts of payments are very delayed. So when you give an advance, the beneficiaries themselves were not sure whether this was an advance or this was a delayed payment. And the thing is, what is the long-term impact? So if you're giving a pensioner 1-month advance, what happens to that 1 month where they don't get that pension? That's also something that needs to be spoken about. And also there's a lot of challenge to actually access these pension schemes, whether it is the disability pension, you're required to show a 40% disability certificate. If you're a widow, you're required to show your husband's death certificate. For the old age pension, you need to show your age certificate. Of course, all of these certifications in themselves are quite hard to access for extremely vulnerable groups. And of course, coming to the inadequacy of the amount, there's been a long-standing demand by the Pension Parishad and other groups. Even the recent study that I mentioned by Hunger Watch speaks about the need to increase pensions to around 2,000 rupees. And another point that I just want to make here is that the access to banks, during lockdowns, the access to understanding whether you got this amount becomes a bit of a challenge. Just moving on into a couple of recommendations. So one is, when we talk about relief-based social protection, there is a need to look at an improved identification of beneficiaries, because the number of the people who actually need to access relief versus those who are actually accessing relief, there is a huge gap in this population. One is the user of pre-existing databases would really go a long way instead of creating new ones. And in the case where you need to create new databases of people who are previously excluded, there need to be different kinds of methods to do. There are already lists, there are applications that are unprocessed that sort of need to be reviewed. When you are looking at creating new databases, how do you make them swift and efficient? How do you make them, that you do it, it's done in 10 to 15 minutes. It's not a process where you need to keep going back to a department at least 10 times, show 10 different documents. That's really not the way in which relief will be adequately provided. And of course, very importantly, while we are moving on to an offline, an online process of everything being linked, your Aadhaar and mobile have to be linked to access any form of social protection. How do you also create offline process, simple offline processes? Because while, when you have a technology dependent social protection enrollment system, the need of an intermediary becomes extremely important. It's very difficult to expect a vulnerable person to be able to access technology, internet, computers, etc. The other thing is, when you talk about relief-based social protection, the need to ensure awareness is very, and timely awareness is important. Many of the beneficiaries, especially in rural areas, we found who were completely unaware of these relief schemes, and then it becomes easy to not provide the relief to them, and also a lot of pilferage within the system. In terms of adequacy of relief, especially when these relief programs are piggybacking onto an existing social protection scheme, whether it is food security, how do you look at it to be nutritionally secure? How do you ensure relief for pensioners is actually substantive, not just an advance? Most importantly, like I know the presenters before me have also spoken, how do you build a gender responsive social protection system? Most of the female respondents who we spoke to, for example, among the domestic workers, were least knowledgeable about the domestic workers, the cash transfer. And similarly, in female-headed households, they're least likely to know about the ration that is provided through the TPDS, whether it is through the PMGKY. So how do you create these gender-responsive social protection systems? There are a number of bottlenecks within looking at the delivery of benefits. However, there are ways in which this can be overcome. The actual implementation of the One Nation, One Ration, to make it as smooth as possible, ensure that there is the design of institutional relief delivery is done in more creative ways. Can the post office be included? Can postal, a way in which the postal service is included? It's not just that it comes into the bank, because in rural areas it is difficult to access the bank, update passbooks, etc. How do you get different actors involved in sort of eliminating these bottlenecks? And of course, during relief, because it is so it's done in a very fast manner, there are also a number of people who may have all their documents, etc., but don't access this relief. And there's a need for some form of grievance redressal, either a helpline or some form of grievance redressal, whereby people can actually say that we have not yet got this relief. Is there something that can be done to sort of speeden up the process? Just a couple of, looking at social protection as a holistically, we need to look at evidence-based action delivery towards informing social policy and creating an MIS. And this is something that we're also actively looking at. How do you ensure that how do you ensure integration of the social protection scheme? So from when we look at a life cycle based approach, how do you ensure that a child born in 2020, has accessed all the government social protection schemes, as well as if it is a child with disability, then how do they access the disability pensions? Going on to maybe the PDS, the family access, there needs to be some sort of integrated management system that looks at protection of extremely vulnerable groups through a holistic system that is controlled at the state and central level, because both these bodies provide social protection. Of course, just moving on, there is a scope for collaboration, a lot of scope for collaboration to ensure access to social protection. So whether these are collaborations with civil society organizations, parastatal bodies, they can be involved in developing these action plans to ensure that that last mile delivery actually happens, but involving them in a more formal process, not through an informal way, which is already taking place. So whether it is the MSRLM, MAVIM, Gram Panchayats, how do you include them in the delivery of social protection becomes very important. And of course, just a last point is, when we talk about a comprehensive social protection, what is it that we need to look at? Of course, the increasing budget allocations is extremely important, but also looking at it from a holistic life cycle approach, not just as piecemeals that pensions need to be given or food needs to be given or cash transfers need to be given. How do you see it through the life cycle of an individual? Yeah, so I think I'll end my presentation there. I'm sorry if I've overshot my time. Just a little bit, but
Can't hear you, Roshni.
Roshni, we can't hear you.
Can't hear you at all. Roshni. No, nothing. Suddenly something snapped at your end.
I think somebody should be calling Roshni on a mobile.
Yeah.
Hello, Rajeshwari, can you hear?
I can hear, but I could not hear Roshni for whatever she spoke. And it's not just me,
Could you
many
just
of us.
start? Roshni is right here. There's some issue with her sound.
Okay, shall I try to do what I'm supposed to do now? If that's
Can
what
you hear me?
Roshni,
Roshni,
shall
you
I
can-
try to summarize? Is that what you are asking me to do? Because we lost you in between. Okay, she says, please start. So I will. So let me, I will not try to even attempt to summarize because it was such a rich discussion across broad spectrums of urban, rural, specific to Maharashtra, across the 5 states, that it will be very unfair on my part if I were to summarize, but I will give you a few highlights of, in terms of the broad findings and therefore what would be the broad recommendations going forward. What I would like to look across is, across the 3 speakers, there were certain issues which came out as very common, and that is for the care of children, for example, in the context of migration, which were left behind because of the intrastate migration, looking at what has actually worked, whether it's kinship care model or its education guarantee card, how can this therefore be recommended for scaling up and looking at what could make of those specific to the government of Maharashtra, and how can this scheme be revamped so that it can actually help the objectives of what it was meant for. Coming to the education of children of migrants, I think there was this issue of limited choice of. Oh, is it? Can you hear me now?
Could you turn off your video?
I can hear.
We can hear you.
Yeah, we can hear.
Oh, you can. Oh, fine. So, I think others need to mute so that you could hear me. So, education of children of migrants, looking at the issue of limited choice of language of education. How do you ensure that this facilitation of languages for different mediums of instruction, especially in the case of the interstate migrants in the state going to other states, happens? This is a recommendation. Then for in the areas of health insurance, we have heard about the central scheme of Ayushman Bharat, as also of the state-specific schemes which are available, but the state schemes do not cover the interstate migrants. So clearly, that is a big gap. So the recommendation would be, how do we converge better between the central and the state schemes and include the interstate migrants into the state health insurance schemes? For Manrega, there is a provision according to the scheme, like Mukta says, the intention is there for childcare at work site, but it's not implemented. That's what the findings have come out. So how can this be now made provision for in all the Manrega work sites, especially in the tribal districts? And how do you expand this Manrega to also the urban situation, so that, because there's a lot of urban employment guarantee schemes that would also benefit those who are migrating within the urban areas. The issue also came about enrolling children in the ICDS centers and lack of accessible Anganwadi centers near the work sites. And I would even take the example of the sugarcane cutting, which I was discussing 2-3 weeks ago, where there is a need to set up through the the employers, sugarcane employers association, to set up on-site alternative learning schools and set up ICDS centers closer to the work site so that the children don't miss out on this preschool education and preparation for primary school later on. Coming to the construction workers, the domestic workers, the rickshaw drivers, there is, of course, a registration done, I understand, from the state government, but it is a challenge for all categories, and especially these categories that I mentioned. So there is possibly a recommendation around, let's say, leveraging the civil society and the labor department for extending this to these normally left out categories of domestic workers, rickshaw drivers, or migrant workers, and setting up an employment platform to possibly ease the job availability for migrants coming into Maharashtra, with an attention for informal skill mapping, which should include, I believe, digital literacy. On the urban ICDS, we all know that there's a limited space, limited staff, not enough monitoring of the urban ICDS, and also not enough of convergence between the ICDS, which is run by the woman and child, and the municipal corporations. So they don't work, actually they work in silos. So the important thing here is, of course, urban ICDS requires additional funding, requires better human resources, and would have some sort of linkage with the municipal bodies overseeing the process in the urban Anganwadi centers. On the targeted public distribution system, the TPDS, it was part of the relief package for more for rural than for urban areas, but the issue is of portability, which needs to be better studied and designed. Reference was made, I think, to specific schemes like Shiv Bhojan Thali for MCGM areas, where there were locational issues and issues of quality control. And these are emerging issues which will require a little bit of revisiting the schemes itself so that it can be made more useful. Same is with the tribal families for the Anudan Yojana. What was that? Khavti Anudan Yojana, the fact that payments go very late. So this is where I think Gram Panchayats can help in increasing the access to these schemes. Majhi Kanya Bhagyashree was, of course, a big flagship from the state government, but there was a lot of resistance from the beneficiaries because there's a conditionality that you should have sterilized yourself to get benefits of the scheme. Now, some of these can easily be revisited so that Majhi Kanya Bhagyashree gets to those who are actually in need of it. The National Creche scheme for some reason got discontinued, but I think there is scope, according to the evidence from the study, for it to be revived and implemented. Same goes, I believe, with the scholarship schemes in education, where the government resolutions that have been framed were quite outdated. These now need to be redesigned and ensure that it is in sync with the contemporary situation on the ground. So overall, if I were to go across the three presentations, I think the issues that have come out is the lack of documentation available with the beneficiaries, which does not allow them to access the services, lack of information that they don't have, that they are eligible to avail of it. And I think the IEC is not necessarily friendly for this category of population, especially the women who may not even know that they're eligible for certain benefits, leave alone the children. There is also absence of any SOPs or standard operating procedures so that you can benchmark a program performance and track it later on. This was a concern. There was also the issue of silo in health and nutrition between tribal and health or tribal and nutrition. And so one does not speak to the other, whether it's a health insurance scheme or a scholarship scheme. Therefore, it leads to need for more convergence. There was also in terms of budgeting and accounting for the budgets, there were different what is allocated, finally what is sanctioned, and from sanction what was received. And sometimes there is not a clear line that divides them. And therefore, some schemes have remained displayed in an irregular, let's say, funding pattern, not knowing when the fund will come or the fund coming too late. This also leads to the issue of establishing monitoring and evaluation frameworks so that these programs, no matter they're centrally sponsored or state sponsored, can be regularly kept on track. What is seriously missing is the role of the elected representatives. They are not part of the planning, they are not part of the design, they are not part of implementation, and therefore not part of monitoring. So some of the takeaways going forward into the next session, which Yunhee will present now, is is there a possibility of setting up a social protection system in the state? What are the ways by which we can possibly develop synergistic partnership between civil society who are on the ground and government who design? Can we make specific recommendations regarding the role of the elected representative, prioritize specific sectors or groups for designing an advocacy strategy. Even I would go social protection. So if today from this meeting, we are able to get 2 or 3 takeaways, one of which I believe would be, like was done for the last year in the second wave, a geo-NGO forum, a collaborative forum where the government calls for the meeting and the specific NGOs come and present on the social protection schemes and what should be the recommendation. I think that will be a very good way forward. And the schemes evidence that has been presented today, including their recommendations, if we can form 3 or 4 thematic groups, don't spread too thin, but take 2 or 3 issues and tease them out until it reaches its logical conclusion. I think this consultation for social protection will have a lot of meaning. I stop there. Thank you. Over to you, Roshni.
Thanks so much, Rajeshwari. I think you did give us a bird's eye view in terms of how we need to actually move ahead, which is so important, and very, very happy to have those thoughts. We will shift to the next section of today's conversation, and for that to set off, which is the strategies. We've heard a lot about what are the gaps, what are the challenges, as well as recommendations. I think now we really want to know what actually different groups are doing, and which is, we're all waiting and very excited to listen to that. I would like to open the floor by introducing Hyun Hee. Can you just say, yeah. Hyun Hee is the Chief of Social Policy and M&E for UNICEF India, and she has several decades of experience in the area of social protection and social policy. And we are really, and we all know that social protection is the right of every child. So very excited to have Hyun Hee here with us and share, her perspectives on social protection for children, women, including adolescents. She will spend some time covering UNICEF's approach and all the game changer strategies which they are employing both globally and nationally. And I know Hyun does a lot of work across the country, and there are several things I think we can learn right from Jharkhand to Kerala, and I think we're all very keen to hear that. So welcome, Hyun. Thank you so much for being here. Before I hand it over to you, I just have a small announcement to make. There has been an emergency meeting called by the CM and the Deputy CM on the women's policy in Maharashtra. So the WCD rep, the Women and Child Department rep, as well as Anuradha and other colleagues do have to go and join that meeting. So we may not be able to hear them in the later sessions, but if they're able to join back later, we can hear from them as well. But that notwithstanding, over to you, Hyun. We're very excited to listen to you. And I think you can share.
Thank you so much, Roshni and Marina from YUVA, and Raji and Anu for inviting me today. And great to see Mukta from CPR India as well, and the presentations from the Regional Center for Urban and Environmental Studies. Really excellent presentation. And not least, I want to thank my colleague Veena, the social protection specialists in Delhi who've been preparing for this presentation. So let me just share my slide. So a beautiful child from Gujarat. It really made me smile. So another big focus is around social protection to support nutrition, but really excited to be here. I think it's an exciting platform. I'm not sure if other states have such a platform that brings together UN, civil society, academia, government, and different partners. So really congratulate YUVA and the UNICEF Maharashtra team. And I would love to learn because I am actually quite new. I joined in October. As Roshni mentioned, I did have a chance to travel to different contexts, such as Jharkhand as well as Kerala, but also Maharashtra very briefly. So my understanding of the landscape is a little bit limited, but I have Raji, Anu, and my colleagues here to also share their insights. So today I'll be sharing a little bit about UNICEF's kind of approach to social protection. I won't go through what social protection is because here, I think everyone in this group today, your bread and butter and passion is social protection. But just to frame where we're looking at social protection from the right. So UN Convention on the Rights of the Child, we frame and recognize the different needs of children of different population groups. Children are the first and hardest hit by adversities, as we've talked about during the COVID-19 pandemic. Someone talked about the additional 115 million in India that was pushed into poverty after COVID-19, and the majority that faced the brunt of the kind of devastation were children and women. And this is why we're focusing on children and multi-dimensional needs and deprivation of children and women. And they're invisible, as Mukta and many colleagues have said, the migrants, the different groups, segments of population that are invisible and unintended. So they're not getting the social protection services and the other needs that they need. If you just recall, as of November, we talked about 286 million children that were affected by disruptions due to education, school closures. And given the school lockdown and the closures, children were more prone to child labor, violence, abuse, sexual abuse, and different kind of deprivations. And social protection, it's not only touching about goal one, end poverty, it talks about health, nutrition, the rights to education, gender equality. So it's very much linked. Let me just go through our new strategic plan. So UNICEF, those who may not know, have just launched a new strategic plan, a global plan. And social protection is forefront. So the vision of our goal area 5 is around every child, including adolescent, has access to inclusive social protection and lives free from poverty. And this is particularly relevant after the COVID-19 pandemic, where we need to use social protection as part of the inclusive recovery of countries. The key principles are around best interests of the child, progressive realization of universal coverage. We talked about national systems and leadership. I think in India context, a lot of the state governments have a huge role to play, as seen in the presentations by colleagues today. Inclusive social protection. So we can't forget about the migrant children, women that many of you talked about today. I wanted to highlight, we have a new executive director, Ms. Catherine Russell. She only joined a few weeks ago, and one of the first speeches that she made to the organization and globally was highlighting that social protection is an integral part of the COVID-19 pandemic response and recovery. So this is, I just wanted to highlight where we're placing as an organization. For the first executive board presentation she made, she talked about the, the cost of this pandemic for children. But she also talked about the need for governments to invest in systems such as social protection. She also talked about primary healthcare to support children and families. And children should be put forefront in national and local pandemic response and recovery plans. And we have a dedicated associate director in New York that covers social policy and social protection. So Ms. Natalia Winder-Rossi also talked about scaling up investments in social protection is a proven strategy to reducing poverty. So in a few documents, UNICEF issued, they talk about how if you invest $1 in social protection systems, you give back about $2.5 back to the community. So this has not only a monetary but overall multiplier effect to the community. So this is why we, as UNICEF, focus on this. And I won't go through this detail, but as you know, social protection covers not only the social vulnerability. So a lot of you talked about the exclusion, discriminations, the vulnerability due to disability, age, but also since COVID-19, huge loss of income for families. So loss of, the issues of unemployment, limited economic opportunities. And now we talk about the CCC at the moment, globally, threats of climate, conflict, and COVID-19. So I think a few of you mentioned also the climate shocks that children and women face today. So the context in which we operate, we really need to use this momentum where to strengthen social protection systems. So we have a vision to protect children, prevent children, protect, prevent, promote, and transform. basically transform the lives of children through providing social protection systems that are linked to all of these basic services, as Raji has mentioned, about education and health and safe water and sanitation. So we talked a lot about the life cycle approach. So this is just a diagram. I won't go into detail, but we start looking at social protection from pregnancy to the first 100,000 days, child grants, maternity grants. As UNICEF, we really think that we need to invest in those years. The human capital we call. If we lose this segment from now, from 1,000 days to up to 6 years, this is where the cognitive and the physical development happens for children. So if we miss this opportunity, it also has repercussions to the overall growth of the country. So we looked at 3 to 5 years old, the child grants, child care services like Angawati centers, 6 to 10 years old. We advocate for child grants, education waivers, a school feeding, such as a midday meal. 11 to 17, the child grants, but really at this age, from adolescent and youth, the transition from schools to employment and skilling. So a lot of the programs that we do have focus on this, and India does have many programs around the life cycle, including adulthood, the MG and Rega, looking at the public works type of programs to generate employment, and also looking at old age pensions and social care. So we look at the whole kind of life course, and a few of the panelist members have recognized the need to use a systems approach and ensure that we design around the life course. I wanted to just take a bit to introduce the UN Secretary General. Actually, this last year prepared a policy brief, and he talks about investing in jobs and social protection for poverty eradication and sustainable recovery from COVID-19. So even in this brief, you can see it's a whole UN-wide approach. It's not only from UNICEF. So they talk about these types of social protection floors that looks at a life cycle approach as well. So they're talking about maternal care. They're talking about basic income security, like universal child benefits, focusing on children, and all of those things that I just mentioned earlier, and looking at the working age population, as well as old age. So this is a whole UN-wide approach, and there is definitely, as many of you talked about, the need to collaborate, coordinate with partners as CSOs and academics that are part of this group. And in a nutshell, what should a child-sensitive social protection system offer every child? We would like to see a vision where every child lives in a household with sufficient financial resources to develop and fulfill their potential, have access to quality basic services. They have also the knowledge for development regardless of income or personal characteristics. So it's not only about giving cash, it's also the cash plus referrals to social services like health, education. These are critical that we look at. And we also look at the social outreach workers. They need to, a lot of you have talked about the lack of awareness of social protection entitlements from community level, the importance of IEC, the importance of actually going out to the communities, like self-help groups, which I've seen in Jharkhand, that were actually having help desks to go out to the communities, talk about what type of benefits, social protection services are available to them, actually unlocking the bottlenecks so that they can actually receive those benefits. So I think CSOs have a critical role to play in partnership with PRIs, with urban local bodies, as many of you mentioned. So here I wanted to just give you a little bit of what we're focusing on at the national level from UNICEF. So what I mentioned is we have a national program here in Delhi, and we have 13 state offices all over, and Maharashtra UNICEF office definitely leading the way in terms of innovative approaches to social protection. And here what we try to do is learn from the states, their experience, key evidence, recommendation, and we would love to take it to the national level and other states to learn. So we have been working on an agenda with NITI Aayog around an integrated social protection framework agenda. So we've just undertaken a few micro simulations of 13 social protection programs in India. So those are listed here, and some you have already mentioned in your slides. And it was to evaluate the adequacy, impact, efficiency of programs and propose a recommendation based on a modeling of program design changes, looking at perfect implementation scenarios. If all of the bottlenecks were removed, what would it look like, and how would the populations benefit? And we are actually also doing, because a lot of you talked about the systems approach, we're using a light touch core diagnostic tool. This is looking at the system, the status of the social protection system in a country, using a standardized and coherent approach and using common vocabulary around social protection. And it's a agreed kind of methodology used by World Bank, UNICEF, and ILO. And UNICEF supports CODI approach in many countries around the world. And we started undertaking a light kind of exercise and looking at policy and legal frameworks, even the financing, a few of you mentioned, program design, what are the key design features, delivery, many of you talked about the bottlenecks around enrollment, payment, grievance redressal. So these are some of the issues that we're looking at. So let me just outline merging kind of points that are coming out. And I think these are pretty much something that you already spoke about in the previous presentation, the need for an integrated social protection system. There are multiple fragmented schemes, over 600 central schemes and many schemes at some state level. The value or the level of funding going into certain schemes are also quite low. And there's a need for rationalization, as some you have mentioned, and also integration. Policy and legal framework. I think India does not have a national social protection policy and strategy like many countries. So this is something that we would like to support NITI Aayog and government work on at national level, and we've been discussing. Institutional financing framework. We also don't have an overarching institutional framework for social protection looking at the life cycle, as you mentioned. We don't have yet a formal kind of coordination mechanism. Some countries have national social protection working groups that are convened by the government, inviting partners. Here, I think the Maharashtra model is very exciting, really innovative, and I really want to take this experience and share with different states and government partners. And we recommend increased investments without funding. We can't really, currently the proportion of social protection expenditure is only 1.4% of the GDP. So it's a bit lower than the regional and the other middle income country average. We recommend, and there's a few issues related to design aspects that I won't into get there, but we do recommend transfers to be indexed to take into account inflation, given that communities that receive the benefits could lose purchasing power and effectiveness by the actual transfer value. And we do have many conditional cash transfers, but those working in the front line will know that you talked about documentation. There's a huge administrative burden as well when things are very conditional, and there is a lot of evidence to support the power of unconditional cash transfer and cash plus approaches. In terms of the delivery, a few talked about robust social registry systems to avoid duplications, overlap, exclusion errors. We also think that there's a lot of entry points in terms of driving an integrated social protection agenda. We're learning very closely what's happening in MP. My colleague here, Veena, who used to work in MP, has experience in Samagra, but there are other kind of models out there that we're looking at to kind of take good experiences and practices, and if we can maybe help other states learn, or at the central level design something. We have, these are something that we talked about. In terms of beneficiary identification registration, we all talked about the low levels of take-up. During the COVID-19 period, we did what's called the community-based monitoring kind of approach, real-time data collection, going to the communities. And we realized there's many social protection schemes available at the community level, but not many were aware, especially older persons, widows, and people with disability, and really need to generate more awareness. And I think partners have a role to support and work with the government. And then delivery mechanisms, portability of social protection, I think this came up, and we at UNICEF have been working with CPR India around setting up a policy kind of discourse around the study that Mukta presented. Because several other states were part of this study, and there was a national kind of dialogue with the Niti Aayog, the government partners, academia around this, and we hope that this is something that we can take forward and reflect in the upcoming draft migration policy that's being worked on by Niti Aayog. And then complaints and appeals, this is just an observation that in India, it's increasingly centralized and digitalized, as many of you mentioned. So one of the last points, as I mentioned, there is definitely a space for us to partner, coordinate together among NGOs, government, and civil society. And evidence and M&E came up quite a lot in the presentation, so we're pretty much aligned in terms of looking at an overarching framework for monitoring and evaluation, doing kind of ensuring there's capacity to review and assess performance of a system as a whole. This is one of my last slides. In UNICEF, from a global perspective in the new strategy and in our new country program, what are our game changers for social protection? So linking looking at the child multidimensional poverty deprivation to drive the agenda and targeting. Better understanding of the new poor. Someone actually mentioned this new word. There's now new poor that we haven't really talked about before that needs to be brought up, and we need to pay attention to these new groups. Climate impact of children, recurring floods, cyclones. This is a daily reality in many of the states that I learned when I joined UNICEF in India, and something that we need to design shock responsive social protection programs around, and need to do it before the actual shock and stress happens. A critical focus on financing social protection. So we can't just implement, we need to also advocate for increased financing for social protection, because as I mentioned in my earlier slide, social protection is a right. And if you look at advanced countries, economies, they actually dedicate and invest quite a significant amount in of their resources in social protection, because it has multiplier effects to the economy and the society. And also decentralized platforms, we need to leverage them to provide and deliver social protection to the last mile. So we talked about gram panchayats, the urban local bodies. There's many innovative models like linking the self-help groups to PRIs. We have worked in Jharkhand and Odisha with Pradhan. And I've seen firsthand all of the difference their work has made in the communities. Expanding coverage of social protection. So we need to jointly advocate as a community around universal child benefits, and many evidence around this, that actually it increases GDP. If you invest in universal child benefits, and there's a study that was done by ODI, gender transformative and shock responsive social protection. As I mentioned, this is critical and a game changer. Let me just let you know, based on this, we're designing a new country program. UNICEF, we're designing a 5-year country program, and our social policy program for the next 5 years, therefore, does not only talk about social protection, but it links the measurement, child deprivation measurement, socioeconomic analysis, the CRVS, with the kind of issue of social protection. We have a PFM program that we use and leverage to try to advocate, generate analysis, and advocate to increase public resources to social protection, and also identify innovative financing for social protection. We also have a child-friendly, gender-sensitive local governance program that we have, and we work in both urban and rural spaces, and we're trying to leverage our existing program to support, to ensure that all children and women have the right and access to social protection. And I think the way forward, this is an excellent start. So I think, as Raji mentioned, I would be very keen to use this platform to build a common advocacy agenda around child-sensitive social protection and shock responsive social protection. This could be the basis of a knowledge community, like a community of practice with researchers and practitioners. And we would love to learn from you around scalable social protection models that we can showcase, and other states and at national level we can learn from. So this is just the last slide. Social protection is a right of every child. And we have different tools available in our website that I hope you find useful. So thank you. And then I had listed all the people I wanted to thank because I'll miss them. But I can't read out because probably I spent too much, but you know who you are, you made this event happen, and I really, really appreciate this opportunity. Over to you.
Thank you so much, Yoni. You are always so gracious and so kind of you. And I think wonderful presentation. I think really, I love the way you really put out the framework for integrated social protection. I mean, I think that's what we keep talking about, and right from policy design to implementation to participation and financing, both of which I think are so important. And that's really where the role of civil society comes around in terms of holding the state accountable. And really, even Avani talked about, having formal ways of civil society participation. So I think that's really, it was very, very useful and good to direct our future conversation as well. I'm really excited to move on now. Thank you so much for being here with us for this long already. But I know this is a very, very important conversation. And that's why we're all here. I will move on to the next session, which is the session on strategies.
Roshni, you're on mute.
I think we have all our speakers here. We're happy to have Professor Dr. Abhay Shukla with us, who is a strong, thank you. Hi, Dr. Abhay. Thank you so much for joining. He is very well known to the state of Maharashtra. He's part of the JHA campaign, as well as, he's also with Sathi and Sehat. So thank you for being here. We also have Ashwini Kulkarni. Thank you for joining us. She is the founder of the Pragati Abhiyan, and she has a lot of experience in the livelihoods and the NREGA space. So thank you so much for being with us. We also have Santosh Shinde, who is an expert in the child rights space. He's been part of many committees and networks, also a former member of the the Maharashtra State Child Protection Committee. Thank you all of you for joining. We also have invited and got confirmations from Rahul More from the DWCD, as well as Prashant Pohare from the Planning Department. Unfortunately, neither of them are here currently with us. Rahul has had to go for the women policy meeting, like I mentioned earlier. And Prashant Pohare, we are trying to reach him. So in case he joins later on, we will call him on. I think both very key actors for this side of a conversation, both from the planning end and from DWCD. So we're hoping they be here. And if they don't, we will find other ways to keep in touch with them. And we have Amit Narkar from Arohan, who is the CEO of Arohan, earlier with NCAS. He is been several decades of experience in the development and governance sector. I'm very excited that Amit has agreed to moderate this session. We are really looking forward to hearing the strategies people have used, the challenges, and how they see in terms of practice, how do we really take forward the integrated approach. So I will hand over to Amit, and to take forward this session. Over to you, Amit.
Thank you, Roshni. Thanks, YUVA and UNICEF for organizing this very important conversation. Am I audible, Roshni? Yeah.
Yes.
So starting with the studies and now moving on to actually people who are working with the communities on issues, who have been working on these issues, especially the sectors which they are expected to speak on for decades together. We are having this conversation on the backdrop of a very horrific pandemic, which changed the landscape entirely. And now probably we are thinking of dealing with the situations in the post-pandemic era. So the scars that the pandemic has left us with, and then how do we really cope with the challenges which are unfolding, probably new challenges every day. So a lot of insights from people's experiences while working on field, dealing with actual designing and implementation of policies, understanding people's issues in various areas. That will in a way give us some understanding of how we can move forward in the direction of probably designing more appropriate policy solutions, more proper and honest implementation of those policies, and also to find spaces for convergence between the civil society organizations' works and the government policy making and policy implementation. So here we have a very fantastic panel in front of us. I'll not speak much because I know the people who are part of this panel, they have a lot to share with us. Dr. Abhay Shukla, he has been a veteran activist in the people's health movement. Then we have Santosh Shinde, who has been working tirelessly on the child rights issues. We have Ashwini Kulkarni, who has been a very vocal person on the issues of migrant workers, the Rural Employment Guarantee Act, and we are also expecting a couple of representatives from the government side, and especially interestingly from the Directorate of Economics and Statistics, because that is something which really is an important issue where even the CSOs have to focus their attention. So just to begin this conversation in this very important session, I just had three broad points in my mind, and I would request the speakers to, if they could, address these issues also while presenting their talks. So one, of course, is the issues and challenges that they saw during the pandemic and they see in the post-pandemic era in their respective areas of work. So what are the issues and challenges that we feel which need to be addressed through the policies? Second is the performance of the policies and going by the critique of policies which have been implemented, which have been designed. So what is the critique of those policies, where we find the gaps and where are spaces for improvement? Then, of course, what needs to be done, and there I wouldn't ask these people to speak about the larger policy direction and these things. But in the aspect of the civil society work during the pandemic, the civil society work around the social protection issues, and what the civil society work can offer to the policy making, and also if they could identify spaces for convergence between the civil society organizations works and the government policies. So 3-4 main points: issues and challenges in the policies, then performance of the policies, a critique of the policies, and then are there any spaces for convergence between the civil society and the government? So looking at the limited time that we have at our disposal, I would request each of the panelists to limit their initial presentation for 10 minutes. I'll switch on my camera after 9 minutes. So that will be a reminder that you will have to wind up in 1 or 2 minutes more. So not more than 10-11 minutes, everybody will get to speak in the beginning. And then once all the three speakers have done their initial remarks, then we can open the floor for discussion. And if we are able to get the government people on board, then we will also listen to what they have to offer. And in the end, since I've been given the job of moderator, apart from timekeeping, I'll also try and summarize the presentations and then offer something from my own. So thank you very much, and welcome all the eminent panelists. So the order in which we would like to go here, looking at the time constraints and people's commitments, I would request Dr. Abhay Shukla to go first, Then Santosh will speak, and Ashwini Tai in the end, if that is fine with the panelists. Okay, so yeah. So may I request Dr. Abhay Shukla to begin his presentation. If you have a presentation, we'll start with the presentations, or I mean, you can also have just plain speak.
Yeah. So yeah, thanks a lot to UNICEF and YUVA and all the organizers and also the previous speakers who have laid out a very important range of experiences and perspectives about social protection and the need for convergence, especially in the context of Maharashtra. On behalf of the People's Health Movement and also on behalf of Sathi, I have a short presentation which I will share. This was made very quickly, so just today morning when I realized that I can make a presentation. But I hope we can also revisit some of the points in the discussion. The presentation is titled "Unmute the Mic," and there's a background to this. Just 3 days back, I was in a major state-level official online meeting chaired by the Chief Secretary of Maharashtra, where Secretaries Health, Tribal Development, WCD, etc., were all there. And a few of us as civil society members were there. And our mics were centrally muted. And during this discussion, which is incidentally about child malnutrition in Maharashtra, something quite relevant for UNICEF also probably and for all of us. And till the end of the meeting, our mics were not unmuted. We kept sending messages in the chat box, we want to say something, we want to add something. The meeting ended without us being even able to speak. I think this small experience, that's why I've called this Unmute the Mic. The dialogue spaces in Maharashtra between civil society and official actors and governments are really need to be opened up and expanded. This is going to be my main theme. And if as a result of today's entire discussion, we can open up these spaces in some form for social protection, for child protection, for overall health, nutrition, and other public services, it will be a huge step forward. And I'll also be talking a little bit about some of our experiences about convergence. The COVID pandemic has been a very traumatic experience for people across the world, across India, and definitely in Maharashtra. There are thousands of stories which we are hearing. There are hundreds of stories which we are literally hearing, those who are working on the ground. I'm sure that everybody in this call who is working at the community level, you will be having some such stories about how people have been affected by the pandemic. But the stories are not only negative. There are also a lot of positive stories about what people have done collectively as communities, as panchayats. These stories need to be told and these stories need to be heard. And I think dialogue will take place only when both happen. So how can we open up systematic platforms for dialogue and critical collaboration? Because the collaboration will be critical, it will not be uncritical, but that collaboration is absolutely essential in the light of the COVID pandemic. And not just civil society organizations, but women's groups, various kinds of social groups, Panchayat Raj members, urban elected representatives, all types of social actors, wherever they have come together during the pandemic, important positive impacts have taken place. And where they have not been able to come together, we have seen the consequences of that. So I'll be talking about just a few strategies, because the whole session is on strategies, which we have actually tried out in Maharashtra and which probably can be learned from, and for taking this entire dialogue forward. So I'll first of all talk about convergence from below. When we talk about convergence, somehow the idea is that, officials of different departments will sit together, which is of course important, absolutely. But we have seen, and I'm now talking about child malnutrition in Maharashtra, which unfortunately has increased a lot during the COVID pandemic. Lack of convergence between ICDS, health, and various other departments has been a significant issue. So this is the experience of the Community Action for Nutrition process, which was supported by the Tribal Development Department of Maharashtra, an officially supported program in 400 tribal habitations and villages across 7 districts, tribal districts of Maharashtra, from Gadchiroli to Palghar, from Nandurbar to Raigad. And these are 2 years just before the pandemic started. And we saw that convergence from below in terms of bringing together various existing committees at the village level. There were 3 committees at the village level which were looking at child nutrition: Ahar Samiti, a Mata Samiti, and a village health and nutrition committee. So we basically said we have to converge these together and bring people together, and also converge the efforts of frontline workers, Ashas, Anganwadi workers, various other frontline functionaries, and also frontline officials at the block level. And this convergence, linked with Jan Samvads and participatory problem solving, has led to a huge range of positive impacts. And we found that when people are mobilized, frontline workers are activated, and public officials are converged. And all 3 of these are linked with each other, but each of them is important. Huge positive changes can take place. This is an example, a live example from Maharashtra, which probably needs to be upscaled. I mean, of course, you'll ask that what was the impact? So we have just recently compiled the data and come out with the remarkable reductions in child malnutrition in the project areas. So a reduction of severe acute malnutrition, major reductions in moderate acute malnutrition, major reductions in underweight among children. So, in a roughly 8 to 9 month period, because after February 2020, the pandemic started, we saw almost 52% reduction in SAM grade, and this is without any external packaged food, any external, supplies, but just improving the functioning of the Anganwadi, improving household nutrition practices, converging, bringing the community, the tribal community closer to the entire nutrition and health system, and with active role by the Asha and the Anganwadi worker being played. And similarly, major reductions in moderate acute malnutrition. Sorry. So I'll not go into the details, but my point is that these are experiences, live experiences, which we have in Maharashtra. And these are not only relevant for nutrition, but even for other sectors. We need to, systematically review these and build upon these and upscale these rapidly, so that so there is no, the finances are actually quite modest, which are involved. The main effort is catalyzing convergence at the ground level and energizing people and frontline workers. The second area I'll talk about is basically what I'm calling public-public partnerships. Whenever public means people and public, coming together, public-people partnerships. We have another example from Maharashtra of Community Action for Health, which used to be called Community-Based Monitoring and Planning of Health Services, supported by.
Can you just
sorry. Was I muted for some time or just
a second?
Okay. So this process, which started in 2007 and was upscaled to cover more than 1,200 villages across Maharashtra in 17 districts, has also shown remarkable positive results when Panchayat Raj members, communities, civil society organizations, frontline health officials, Ashas, all are brought together on a common platform where dialogue and problem solving takes place. The village health sanitation nutrition committees activated. The Rogi Kalyan Samitis are expanded. They are, brought into a problem solving mode. Untied funds are utilized in a better manner. Major improvements in maternal health services, in various other, access to health services. Of course, Jan Samvads, more than 650 Jan Sunwais and Jan Samvads were organized as part of this process. But that is where the difficult dialogues take place. But when difficult dialogues takes place, then problems get solved. So this is another example. Unfortunately, now the funds for this process have been, not released for this entire financial year until now. I'm just giving you also an idea of the challenges that we are facing. So people on the ground are really willing to engage in these kind of processes, but they need to be supported from the state level. And thirdly, learning from public partnerships during COVID in the health sector across Maharashtra, we had dozens of help desks being set up in public hospitals, which benefited tens of thousands of patients who desperately needed guidance, information, hand-holding, mentoring to access care, the kind of situation which was there during the COVID, especially during the second wave. And, ensuring people's access to the Mahatma Phule Jan Arogya Yojana, which was expanded, but people had very little information about this on the ground, ensuring that people are able to access non-COVID services, through a regular feedback mechanism, using social media to give free feedback to local officials about, where actually services are getting affected, where there are bottlenecks. A whole range of such, and panchayats were also quite actively involved in many areas. So this, we had this paradoxical situation during COVID, at least in Maharashtra and probably at the national level, where on the ground level, there was a huge amount of initiative, at least in some places. And at the state level, very little space for dialogue and collaboration between civil society and the state. This is a paradox, in my opinion. We should overcome this paradox. Actually, we have both positive and negative lessons from COVID. We should, transform this into a different kind of, reopening of the dialogue spaces. And co-production of health and nutrition is something I would very strongly like to emphasize. Health cannot be produced by a government, and health cannot also be produced by a community on its own. But when communities and governments work together with facilitation by civil society and elected representatives, health can be co-produced. These are experiences which are emerging from across the world during the COVID epidemic, ranging from vaccination to testing, tracing, and various other kinds of preventive measures to access to care. Co-production is the way forward. I would like to strongly argue that we should open up a dialogue about co-production, and as a part of the whole social protection process also cannot be done without co-production. My last point is about private providers, and I'll be talking about private hospitals in Maharashtra. This is the elephant in the room. 70% of healthcare is provided by the private sector, but we don't even consider this to be part of the public policy or the public, domain. And a huge amount of overcharging took place during the COVID pandemic in Maharashtra by private hospitals. COVID widows, this is also a gender issue. Large number of COVID widows. Maharashtra has more than 20,000 COVID widows. And, these women and other families were severely affected by this overcharging. The Jan Arogya Abhiyan and Corona Ekal Mahila Punarvasan Samiti organized what are called Santap Sabhas or anger assemblies, where women came, they shared their stories, absolutely shocking stories of massive overcharging by private hospitals. This led to a meeting with the health minister of Maharashtra. A very positive decision was taken to audit all these overcharging complaints. So 500 complaints, nearly 500 complaints have been submitted to government of Maharashtra. And I'm happy to share with you that in more than a dozen cases, including COVID widows, thousands of rupees have been refunded. 50,000, 70,000, 80,000 rupees have been refunded by private hospitals where overcharging had taken place. This is just a small example of how even the private healthcare sector can be made accountable if there is political will and there is pressure from below. So, social will and political will from below and reactivation of political will from above. When these two take place, we can even deal with this. I'm sure that private, actors are also important in other sectors, especially like in education and, probably even in other sectors. We have to bring them also on the table in a larger spirit of accountability. And another important outcome has been, due to the entire campaign by Jan Arogya Abhiyan, government orders for display of patients' rights charter. Patients' rights, extremely important issue emerged during the COVID pandemic. People have the right to know, get an itemized bill, know their diagnosis, know their, line of treatment, get records and reports. Not dead bodies cannot be retained in any hospital, etc., etc. So these patients' rights charter, now the government of Maharashtra has come out with an order that all public and private hospitals across Maharashtra must display this Rugna Hakkanchi Sanad. And I think this is something also which we need to publicize. And this is another way in which accountability can be ensured. So my final point is the pandemic should be a portal for change. The pandemic is a huge wake-up call for all of us to reclaim public services through participation. And we need convergence from below, along with, of course, convergence from above. But convergence from below is really what can work to energize these public services. We need to promote co-production of public services, and including for social protection. And we need to make private providers also accountable while re-embedding them socially and bringing them under a public umbrella. Something like, for example, a universal healthcare system where they are both paid and also monitored by the public programs. So a major social churning is now, I think, on the cards in view of the entire COVID pandemic. We need to strengthen co-production and social protection. Governments need to systematically, not just occasionally, not just casually, but systematically partner with people, community groups, and civil society organizations to ensure this. Maharashtra has a huge potential for this. Maharashtra is really rich in social capital of all forms, and it has a tradition of so much civil society action. We are missing out on that. Let us not do that anymore. Let us keep the pandemic experience in mind and now move ahead jointly. I think if this consultation can lead to such a joint platform or multiple platforms being created, that would be a huge positive outcome. Thank you.
Well, thank you, Dr. Abhay. As usual, very fantastic and very crisp presentation. I hope you'll be able to stay with us till the end of this session so that we can have questions and answers and more discussion on the very important issues that you have shared. May I now request Santosh to begin his presentation so that we can have more discussions here. Yeah.
Yes, thank you very much, Amit, and UNICEF and you also. मैं हिंदी में बात करूंगा, इसलिए हिंदी में बात करूंगा ताकि काफी सारे महाराष्ट्र के और भी लोग जुड़े हुए हैं और मुझे लगता है कि इन सारे मुद्दों को हमको कवर करना होगा। हम सबको पता है कि 2 साल की इस प्रक्रिया में क्या मुझे कोई होस्ट बना सकता है ताकि को-होस्ट में मेरा प्रेजेंटेशन भी सामने ला सकता हूँ। एक 3 मुद्दों को लेकर जैसे अमित जी ने यहाँ बताया है, तो इन मुद्दों को लेकर यहाँ बात रखने का मैं प्रयास जरूर करूंगा। सबसे महत्वपूर्ण मुद्दा जो था ये सारे प्रक्रिया में वो है कि कौन से ऐसे मुद्दे हैं जहां हमें लगता है कि अलग अलग मुद्दों को लेकर, अलग अलग प्रक्रियाओं को लेकर हमें काम करना होगा और खास करके महिला और बच्चों के संदर्भ में हम सबको पता है कि इस 2 साल के दरमियान सबसे ज्यादा अगर किसी ने सहन किया होगा, किसी को अगर जो लोग प्रभावित हुए उसमें से महिला और बच्चे ये सबसे ज्यादा प्रभावित हुए। मैं कुछ यहाँ थोड़ी सी आंकड़ेवारी देना चाहूंगा यहाँ पर जो हम सबके लिए पता हो। जैसे अभय जी ने अभी यहाँ कहा कि तो पूरे महाराष्ट्र में काफी सारे लोग हैं जिनके बारे में हमें सोचना होगा। जिन बच्चों ने अपने एक पेरेंट्स को खोया है, माँ या पिताजी, ऐसे 5 जनवरी तक का डेटा है 23,765 बच्चे हैं। जिन्होंने दोनों पेरेंट्स को खोया है ऐसे 739 बच्चे हैं। इस दरमियान एक्सेस टू एजुकेशन यानी मोबाइल के लिए पैसे नहीं है या मोबाइल नहीं है या मोबाइल देने के लिए पेरेंट्स को पॉसिबल नहीं हुआ या डेटा नहीं मिला, इसकी वजह से पूरे महाराष्ट्र में 68 सुसाइड्स हुए हैं। मुझे लगता है कि ये आंकड़ा दिखने में 68 दिखता है लेकिन इसके पीछे बहुत दुख है, बहुत क्या कहेंगे, एक अलग अलग स्टोरीज है, सैड स्टोरीज, जिसको हमको समझना बहुत जरूरी होगा। जिन्होंने अपने मेल या फीमेल पार्टनर खोए हैं ऐसे मोर देन 30,000 व्यक्ति साथीदार हमारे महाराष्ट्र में हैं। इस दरमियान जो एक अच्छी और बुरी, उसको अच्छा कहे या बुरा कहे मुझे समझ में नहीं आ रहा है, लेकिन 1150 चाइल्ड मैरिजेस रोकने का प्रयास डिपार्टमेंट की ओर से किया गया, डिपार्टमेंट के अलग डिपार्टमेंट की ओर से किया गया। अब ये 1150 रोकने का प्रयास किया गया, उसके अलावा और कितने चाइल्ड मैरिजेस हुए होंगे हमें पता नहीं, तो इसे भी हमें समझना होगा। तो ये एक आंकड़ा सामने दिखाई देता है। और इसके अलावा चाइल्ड लेबर को अगर हम बात करते हैं तो फ्रॉम डे 1 जब से इस पूरे एपिडेमिक की शुरुआत हुई थी उसके एक वीक के बाद ही विधायक भारती और हमारे जैसे और ऑर्गेनाइजेशंस ने ये बताना शुरू कर दिया था कि चाइल्ड लेबर का मुद्दा काफी बढ़ने वाला है और उसके रिजल्ट्स अभी दिखाई देना शुरू हो चुका है, क्योंकि 2 साल तक हमारे यहाँ स्कूल शुरू नहीं थे, 2 साल तक बच्चे घरों में थे, 2 साल तक बच्चों को पता नहीं था कि पेरेंट्स के साथ कैसे डील करना है, पेरेंट्स को पता नहीं चल रहा था कि बच्चों के साथ कैसे डील करना है। काफी सारे पॉजिटिव प्रयास मुंबई और नंदुरबार में जहां विधायक भारती हम काम करते हैं क्राई की मदद से, वहां पर हमने करने का अच्छा प्रयास किया और इसके काफी अच्छे पॉजिटिव रिजल्ट्स भी हमें दिखाई दिए। तो मुझे लगता है इन सारे लर्निंग्स को ध्यान में रखते हुए कुछ मुद्दे मैं यहाँ रखने की कोशिश करूंगा। और एक जो आंकड़ा सामने आया इस दरमियान चाइल्ड सेक्सुअल एब्यूज का, ये चाइल्ड सेक्सुअल एब्यूज के केसेस इंक्रीज हुए हैं। ये 5496, ये जो मैं आंकड़ा आपके सामने रख रहा हूँ ये सिर्फ मुंबई का आंकड़ा है, पूरे महाराष्ट्र का आंकड़ा और हो सकता है। तो पूरे 2021 में पूरे साल भर में 5496 केसेस चाइल्ड सेक्सुअल एब्यूज के हुए हैं, ऐसा पुलिस का कहना है। अब ये जो आंकड़े हैं ये बहुत कुछ कह रहे हैं हमें, और ये आंकड़ों को अगर हम समझने की कोशिश करेंगे तो मुझे लगता है कि यहाँ अलग अलग प्रयास किए गए, अलग अलग मुद्दों को सामने लाया गया है, लेकिन फिर भी बहुत कुछ करने की तैयारी हमें इस दौरान करनी पड़ेगी, क्योंकि नेशनल लेवल के ऊपर, स्टेट लेवल के ऊपर काफी सारे पॉलिसीज को लेकर हम सारे लोग बहुत बात तो जरूर कर रहे हैं, लेकिन क्या नीचे ये सारे मुद्दे आ रहे हैं? तो मुझे लगता है कि ये नीचे लाने के लिए हमें वॉलंटरी सेक्टर एंड गवर्नमेंट, इन दोनों का कन्वर्जेंस को भी हमें समझना होगा, देखना होगा। कहीं ना कहीं कैपेसिटी बिल्ड करने की प्रक्रिया को भी हमें जानना होगा। जहाँ जरूरत है वहाँ स्टेट के कैपेसिटी बिल्ड हमें करने पड़ेंगे, जहाँ जरूरत है वहाँ वॉलंटरी सेक्टर्स की भी कैपेसिटीज हमें बिल्ड करनी पड़ेगी। एक और महत्वपूर्ण मुद्दा मैं यहाँ रखना चाहूंगा कि इसी दरमियान लॉ एंड जुडिशरी के साथ भी हमें काम करना पड़ेगा। मैं ये इसलिए कह रहा हूँ क्योंकि इस 2 साल के दरमियान सिर्फ ऑनलाइन केसेस का हियरिंग कोर्ट में चल रहा था, और खास करके चाइल्ड सेक्सुअल अब्यूज के केसेस जहां चिल्ड्रंस कोर्ट में या स्पेशल कोर्ट में इन सारे केसेस को लेकर काम करना था, और उस तरह की व्यवस्था नहीं होने की वजह से 2 साल में बहुत कम हियरिंग इस तरह के केसेस के हुए हैं, और इसका ट्रॉमा काफी सारे विक्टिम्स को सहना पड़ रहा है। मुझे लगता है कभी ये सारे मुद्दों को भी कहीं ना कहीं देखना या समझना बहुत जरूरी होगा। इसी दरमियान एक जो महत्वपूर्ण मुद्दा हमें देखना होगा कि बाल संगोपन योजना यानी नॉन इंस्टीट्यूशनल केयर को लेकर इस योजना का काफी बड़ा चैलेंज हम सबके लिए भी है। मैं कुछ आंकड़े यहाँ आपके सामने लाने का प्रयास कर रहा हूँ। मिशन वात्सल्य ये भी एक योजना इस दरमियान बनाई गई, तो बच्चों के संदर्भ में और जो जिन महिलाओं ने अपना साथीदार, महिला या पुरुष ने जिन्होंने अपना साथीदार इस पूरे एपिडेमिक में खोया है, उनके लिए मिशन वात्सल्य इस प्रोग्राम का आयोजन किया गया है। अभी काफी सारे उसमें चैलेंजेस है। ये सारे दोनों चीजें डायरेक्ट संबंध है, जहाँ बच्चों का और महिलाओं का डायरेक्ट संबंध है। ऐसे योजनाओं में काफी सारे लूपहोल्स, काफी सारे चैलेंजेस हमें दिखाई दे रहे हैं, जहाँ ये सारी मुद्दों को इम्प्लीमेंट करने के लिए ग्राउंड लेवल के ऊपर दिक्कतें सभी को आ रही है। तो इन मुद्दों को भी हमें समझना होगा। तीसरा जो मुद्दा है मिड डे मील, हमने तो 2 साल के बाद में कहीं ना कहीं 1 जनवरी 1 फरवरी स्कूल तो शुरू कर दिए है, लेकिन आज भी हमने मिड डे मील के बारे में सोचा नहीं है। अभी कल परसों सरकार ने घोषणा की कि 15 मार्च के बाद हम देंगे। 15 मार्च के बाद स्कूल कहाँ चालू रहते हैं, क्योंकि होली के पहले ही ऑलमोस्ट होली के दरमियान सारे स्कूल्स बंद हो जाते हैं। हमें यह समझना होगा क्योंकि 15 मार्च के बाद मिड डे मील का शुरू करना कुछ भी नहीं है। आज भी हमारे महाराष्ट्र में ग्राउंड लेवल के ऊपर ये दिखाई देता है कि स्कूलों में खाना मिलता है, इसके लिए बच्चे जाते हैं। पढ़ना सेकंड प्रायोरिटी है, तो खाना मिलता है इसके लिए बच्चे जब स्कूल में जाते हैं, और आज भी हमने स्कूल शुरू नहीं किए। तो एक बड़ा मुद्दा है। तो मुझे लगता है कि ये तीनों योजनाएं जो है, इसका इम्प्लीमेंटेशन ठीक से हो, इसके लिए क्या स्ट्रैटेजीज हम सोच सकते हैं, इसके बारे में भी जरूर इस फोरम में मुझे लगता है कि हम बात कर सकते हैं, बात होनी चाहिए। हमारे कुछ अनुभव है उसके आधार के ऊपर भी हम बात करना चाहेंगे। इसी दरमियान और एक जो महत्वपूर्ण मुद्दा है, कस्तूरबा गांधी बालिका विद्यालय। पूरे महाराष्ट्र में मोर देन 100 कस्तूरबा गांधी बालिका विद्यालय। ट्राइबल स्कूल शुरू हो गए, बाकी सारे स्कूल शुरू हो गए। कस्तूरबा गांधी बालिका विद्यालय हमारे महाराष्ट्र में शुरू नहीं हुए। शुरू नहीं होने की वजह क्या है? तो देयर इज नो ग्रांट नहीं होने की वजह से पूरे महाराष्ट्र में 14,000 से ज्यादा लड़कियां इन स्कूलों में पढ़ती है। उसमें से करीबन 6,500 बच्चियां जो है वो 10वीं की एग्जाम इस साल देने वाली है। कुछ दिनों में 10वीं के एग्जाम शुरू होने वाले हैं, लेकिन ये लड़कियां अभी बालिका विद्यालयों में नहीं है। इसलिए नहीं है क्योंकि वो उनके घरों में है, और घर से स्कूल में एग्जाम देने के लिए आना उनके लिए मुश्किल है। तो शायद अगर इस पूरे प्रक्रिया को हम समझने की कोशिश नहीं करेंगे तो ये लड़कियां इस साल 10वीं की एग्जाम नहीं दे सकती है। उनका रहने का इंतजाम, उनका खाने का इंतजाम और उनके पढ़ाई के साथ साथ एग्जाम का इंतजाम उसी स्कूल में होता है, तो ये लड़कियां शायद एग्जाम दे सकती है। तो ऐसे छोटे छोटे मुद्दे हैं जहां मुझे लगता है कि हम सबको ध्यान भी देना उतना ही जरूरी है। और ये सारे प्रक्रिया में अगर मैं थोड़ा सा आपके सामने बाल संगोपन योजना का एक छोटा सा ब्यौरा में सामने लाने का प्रयास करता हूँ, जहाँ 19-20 में 1920 ये पूरे अकाउंटिंग ईयर में सरकार ने 10 करोड़ 20 लाख रुपए इस योजना के ऊपर खर्चे करने के लिए दिए है, और इसमें से 2 करोड़ 87 लाख 83,000 इतने ही पैसे खर्च हुए। बाकी जो पैसे हैं यानी 7,32,17,000 रुपए हमने वापस किए। इसका जिन्होंने जो लोग भी बजट में काम करते हैं, बजट सेक्टर में या इकोनॉमिक फाइनेंस डिपार्टमेंट के साथ काम करते, तो आपको पता चलेगा कि इतना बड़ा अमाउंट जब कोई योजना का वापस जाता है तो उसे मिलवाने में हमें कितनी दिक्कतें आने वाली है। तो इसको भी हमें समझना पड़ेगा। ये सारे प्रकार इतने सारे हमने रिटर्न किया, इसका परिणाम हुआ। अभी लोग कहते हैं कि एपिडेमिक था इसके लिए हम दे नहीं पाए, लेकिन हमारे पास तो बच्चों की संख्या शुरू से थी, हमें पता था कि इन बच्चों को जरूरत है, हमारे पास डेटाबेस था। फिर इन बच्चों तक हम ये पैसे पहुंचा नहीं सके, इसका मतलब कुछ ना कुछ हमें समझने की जरूरत है, जानने की जरूरत है कि कहाँ हमें ठीक से काम करना होगा। तो इन मुद्दों को हमें समझना होगा। 2021 को इसका देखो आप, इसका इम्पैक्ट तुरंत आपने अगले साल ही देखा। 2021 को हम देख रहे हैं कि सरकार ने सिर्फ 8 करोड़ रुपए दिए हैं। अभी ये दो करोड़ जो हमको अभी हमारे लिए माइनस में है, तो बच्चों की संख्या कम नहीं हुई है। अगर ये पूरे इसमें एपिडेमिक में अगर आप देखोगे, और जो मैंने शुरुआत में आंकड़ा बताया है 23,765 लोगों का, तो ये नया आंकड़ा है जो एक साल में आया हुआ है। उसके पहले के 17,000 बच्चे, यानी 40,000 बच्चों को अभी हमें मदद करने की जरूरत है। तो क्या अभी के बजट में, अभी के स्टेट के बजट में इन 40,000 बच्चों के लिए ये आंकड़ा बढ़ने वाला है या नहीं, ये हमारे लिए चैलेंज होगा। अगर ये आंकड़ा बढ़ता है, बहुत बढ़िया, सरकार के साथ काम करने में और मजा आएगा। अगर ये आंकड़ा नहीं बढ़ता है तो हम किसको यहाँ से डिलीट करेंगे, किसको ऐड करेंगे, ये सवाल होगा। और इन मुद्दों को भी मुझे लगता है कि कहीं ना कहीं हमको जानने की और समझने की जरूरत होगी। और जब इन मुद्दों को हम समझने का प्रयास करेंगे तो मुझे लगता है कि हमको और अलग अलग पहलुओं को भी ध्यान रखना उतना ही हम सबके लिए जरूरी होगा। और ये सारे प्रक्रिया में जो फिर हमेशा का मुद्दा है कि इसमें सबसे महत्वपूर्ण भूमिका कौन निभा सकता है, तो सबसे महत्वपूर्ण मुद्दा शिक्षा विभाग। तो एज एन सिविल सोसाइटी ऑर्गेनाइजेशंस हमें शिक्षा विभाग के साथ बहुत नजदीक से काम करना होगा। शिक्षा विभाग के अलग अलग प्रक्रियाओं को हमें समझना होगा। शिक्षा विभाग के अलग अलग प्रक्रियाओं की भूमिकाओं को समझते हुए हमारे लिए अगले कुछ साल ये बड़ा चैलेंज होगा कि शिक्षा विभाग के साथ हमको बहुत नजदीक से काम करना होगा। क्योंकि आज भी चाइल्ड प्रोटेक्शन के इश्यूज और चाइल्ड राइट्स के इश्यूज और ये सारे मुद्दों को हम जब बात करते हैं तो शिक्षा विभाग के साथ इन मुद्दों को जोड़ना ये हम सबके लिए प्रायोरिटी हो सकती है। महिला और बाल विकास विभाग, जहाँ मिशन वात्सल्य की हम बात कर रहे हैं, लेकिन मिशन वात्सल्य की घोषणा हम लोगों ने की, जैसे अभय जी ने कहा कि हमारे महाराष्ट्र में 30,000 से ज्यादा जिन्होंने अपने पार्टनर खोए हैं, ऐसे लोगों की संख्या है। इसमें महिलाओं की संख्या काफी बड़ी है। और खास करके कोरोना के कारण जो महिलाएं विधवा हुई है, उनके साथ उनके लिए सपोर्ट सिस्टम जो देना चाहिए, उसके संदर्भ में जो कार्यक्रम का लिंकेजेस अलग अलग डिपार्टमेंट के साथ करने के लिए सरकार ने ग्राउंड लेवल से लेकर, यानी गांव से लेकर तालुका से लेकर जिला स्तर तक अलग अलग व्यवस्थाएं तैयार की। लेकिन आज भी इन व्यवस्थाओं की मीटिंग नहीं होती है। मीटिंग नहीं होने की वजह से कोई भी जानकारी आगे नहीं जा रही है। बार बार जानकारी मांगी जाती है लेकिन जानकारी आगे नहीं जा रही है। आगे जानकारी नहीं जाती है तो वापस 11 मार्च को जो हमारा महाराष्ट्र का बजट आने वाला है, इसमें महिला और बच्चों का शेयर कितना होगा, ये सवाल होगा। तो वो शेयर को भी लेकर हमें काम करने की जरूरत होगी, उस मुद्दों को लेकर भी हमें काम करना होगा। ये एक महत्वपूर्ण विभाग जिसको हम हमेशा भूल जाते हैं। और मुझे लगता है कि पुलिस विभाग के साथ भी हम सबको अच्छा काम करने की जरूरत है। इस एपिडेमिक के दौरान पुलिस ने काफी अच्छा काम किया, काफी हमारा पॉजिटिव अनुभव हो रहा है पुलिस के साथ काम करने का, एज एन ऑर्गेनाइजेशन भी और ये सारी भूमिका में। लेकिन इसी दरमियान काफी सारे चैलेंजेस पुलिस को भी आए। खास करके बच्चों के केसेस जब पुलिस स्टेशन में आते हैं तो किस तरह की सपोर्ट सिस्टम, जुवेनाइल जस्टिस सिस्टम है, उसको लेकर हम सब लोग बात कर रहे हैं। लेकिन जुवेनाइल जस्टिस सिस्टम की ओर से पुलिस विभाग को जो रिस्पॉन्ड मिला और पुलिस का जो जुवेनाइल जस्टिस सिस्टम को रिस्पॉन्ड मिला, तो इसमें कहीं ना कहीं काफी सारे गैप दिखाई देते हैं। उस गैप को हमें मैच करना होगा, तो इस डिपार्टमेंट के साथ भी हमें काम करना होगा। तो पुलिस विभाग है, न्याय विभाग, लॉ एंड जुडिशरी, जैसे मैंने अभी बताया कि पूरे महाराष्ट्र में मोर देन 256 से ज्यादा चिल्ड्रंस कोर्ट बनाए गए हैं। लेकिन बच्चों के केसेस इस पूरे 2 साल में बहुत कम, यानी लेस देन 3% केसेस सामने आए। अभी ये केसेस नहीं चलाए गए, 97% केसेस ऑलरेडी पेंडिंग है और इस दरमियान काफी सारे और भी केसेस आए हैं। ये लोड हम कैसे मैनेज करने वाले हैं, उसको लेकर भी हमको लॉ एंड जुडिशरी के साथ काम करना होगा, ऐसा एक हमारा अनुभव रहा है। ट्राइबल डेवलपमेंट डिपार्टमेंट, जैसे मैंने कहा कि आश्रम स्कूल्स और काफी सारे जगह पर आश्रम स्कूल्स के साथ भी काम होना बहुत जरूरी होगा, क्योंकि आश्रम स्कूल्स में आज भी एक्सेस टू स्कूल्स का बड़ा मुद्दा आता है। हाँ, डे स्कॉलर बच्चे हैं, लेकिन डे स्कॉलर के अलावा जो रहने वाले बच्चे हैं, तो रहने वाले बच्चों के संदर्भ में आज भी वापस सपोर्ट सिस्टम अवेलेबल नहीं की जाने की वजह से बच्चे पढ़ना चाहते हैं, बच्चे आश्रम स्कूल में जाकर रहना चाहते हैं, लेकिन काफ़ी सारे जगह पर इस 2 साल के दरमियान जहाँ बच्चों का आश्रम स्कूल में एडमिशन होना जरूरी था, आश्रम स्कूल्स में बच्चों को एडमिशन नहीं मिल रहा है। ये वास्तविकता है। ग्राउंड लेवल के ऊपर बच्चों को एडमिशन, खास करके 7वीं के बाद 8वीं 9वीं 10वीं के लिए पढ़ाई करने के लिए जाना है, स्कूल में एडमिशन नहीं मिल रहा है। 7वीं के बाद लड़कियों के लिए गांव में स्कूल नहीं है, लड़कियों की शिक्षा रुक रही है, और एक बार शिक्षा रुकती है तो अनुभव ये भी है कि उसके 1 या 2 साल में शादियां होने के चांसेस ज़्यादा है। तो इस मुद्दे को भी हमें देखना और समझना होगा। ट्रांसपोर्ट विभाग को भी हम बाजू में नहीं रख सकते, क्योंकि ट्रांसपोर्ट नहीं होने की वजह से इस पूरे दरमियान, यानी अभी तो एसटी का पूरा स्ट्राइक चालू है, इसको लेकर हम बात नहीं कर रहे, लेकिन इसी दरमियान मानव विकास मिशन की बसेस नहीं चल रही है, तो मानव विकास मिशन की बसेस को हमको बहुत बड़े पैमाने पे चलाना होगा। मानव विकास मिशन के जितने भी जिले हैं या फिर जितने भी हमारे एस्पिरेशनल डिस्ट्रिक्ट्स है, वहाँ पर लड़कियों को और लड़कों को पढ़ने के लिए ट्रांसपोर्ट डिपार्टमेंट की ओर से जो सपोर्ट सिस्टम देनी चाहिए, वो एक बड़ा मुद्दा है, जिसको लेकर हमें लगता है कि ग्राउंड लेवल के ऊपर हमें ध्यान देना होगा। और आखिरी में कामगार विभाग, लेबर डिपार्टमेंट के साथ भी हमें काम करना पड़ेगा, क्योंकि जैसे मैंने कहा कि चाइल्ड लेबर का मुद्दा है, तो लेबर डिपार्टमेंट की भूमिका महत्वपूर्ण होती है। लेबर डिपार्टमेंट के साथ साथ पुलिस डिपार्टमेंट की भूमिका भी बहुत महत्वपूर्ण है। तो ये जो कन्वर्जेंस है महिला और बच्चों के संदर्भ में जो भी केसेस सामने आने वाले हैं, इसके लिए पुलिस डिपार्टमेंट, जुवेनाइल जस्टिस सिस्टम, लेबर डिपार्टमेंट, ट्रांसपोर्ट डिपार्टमेंट, ट्राइबल डेवलपमेंट डिपार्टमेंट, लॉ एंड जुडिशरी एंड अदर डिपार्टमेंट, तो इन सबके साथ का कन्वर्जेंस का काम हम कैसे करने वाले हैं, ये एक बड़ा हम सबके लिए चैलेंज है। ये सारे प्रक्रिया में काम करते वक्त हम कौन से ऐसे मुद्दों को ध्यान रखेंगे कि जहां अगले 1 साल, अगले 2 साल, अगले 3 साल के लिए हमें तैयारी करनी पड़ेगी। और इसलिए राजेश्वरी मैडम ने जो एक यहाँ पर सूचना की थी कि हमको छोटे छोटे टास्क फोर्स बनाकर काम करना होगा, हर एक डिपार्टमेंट के साथ मिलकर उनकी जरूरतों को ध्यान में रखते हुए कन्वर्जेंस का मेजर रोल सिविल सोसाइटी ऑर्गेनाइजेशंस को करना होगा। जहां हम आप ये काम नहीं कर रहे, इसके बजाय साथ में ये काम करने के लिए हमारी क्या भूमिका हो सकती है, ये बताने का काम हम कर सकते हैं। मुझे लगता है कि ये सारे मुद्दों को लेकर भी हमें चर्चा करने की जरूरत है, और मुझे अच्छा लगा कि यहाँ पर मुझे ये मौका दिया गया आप सभी के साथ बात करने का। सो थैंक यू वेरी मच एंड ओवर टू अमित। थैंक यू अमित।
Thank you, Santosh. For those who don't follow Hindi, I'll just try to summarize in just a minute. Santosh spoke mostly about the child rights issues and child protection issues, especially during the pandemic. And he said that children are probably the most affected by the pandemic. There are thousands of children who have lost parents, and there are many instances of child marriages. Some child marriages were stopped by the government departments, but there are many child marriage cases which go unreported. Then child labor has definitely increased during the pandemic period. The cases of child sexual abuse have also been reported, and there has been an increase in the sexual abuse of both women and children during the pandemic. The school closure was the major issue for denial of rights and many child protection issues during the pandemic. And then there is a need to work with different government institutions. When we speak about convergence, it's not only the departments which are related to child specific issues directly, but also there are many departments within the government which have many direct, indirect responsibilities towards child protection. So he has tried to map those government institutions with which the civil society needs to work. And in those different government actors, he spoke about the importance of working with judiciary also. And then, of course, he pointed to the inadequate allocations for child-specific schemes and gross underspending by the government, which leads to further reduced allocations for child-specific schemes. So he has tried to cover a range of different things, and there he has very clearly identified the actors with which civil society can work and better convergence can be thought of. So thank you, Santosh. Thank you very much. Let's quickly move on to Ashwini Kulkarni, and I'll request her to share her views on the social protection issues during the pandemic and after. Thank you.
Thanks, Amit. And thanks, YUVA and UNICEF for this opportunity. And I'm really glad that this is happening. And I'm really glad to know that this is not one of the consultations, and it will lead to much more discussions and knowledge sharing. I think to begin with, COVID pandemic put us all into chaos, and the lockdown created a multiplier effect to that chaos. Now, given this, we learned a lot of things. We, in the sense, even organizations like us who have been working with vulnerable groups for decades together were left with a lot of surprises and shocks when the pandemic and the lockdown started unfolding with all its severity. And this is also a time when we realized how disconnected things are, not just within the government, but within several spaces across society. And so it has been a very, very big learning experience for all of us to put our experiences together. Of course, what was most missing and what has come out from your reports also is that the information was missing. Government did not have enough information. We did not have enough information. We did not know what to do with the information when it started streaming in, how to share it, how to make it into a knowledge that can be shared, or how to create these co-learning spaces. So there was a lot of chaos at that time. And we tried to do a couple of things. I will try and share those experiences here. One, of course, was that NREGA was very important, but it was closed down. I mean, one of the things that we need to really rethink is what is essential services, right? I think that can be one of our agenda points. Now, the NREGA was considered non-essential, and it was closed down during pandemic as well as lockdown. So what happens? We were reaching out and saying that, look, we know that there are a lot of processes that go into starting works and making payments. But the point is, where can we make it flexible? So we prepared notes, we started talking to all the stakeholders saying that, look, if we bring in these changes, then NREGA can be implemented in spite of lockdown and in spite of pandemic. What are those COVID appropriate behavior that we can have and have NREGA working in the villages? We were seeing migrants coming back. They were also demanding work, but that work was not available. Work was not being given. But it's only sometime in mid-April that government started realizing and accepting that things need to be done. And at small places like in Nashik, we could have meetings with the CEO, Jilla Parishad, and think about ways in which we can make it work in the villages. What are those processes that can be shortened and changed so as to make NREGA reach? There are several issues, and now we do know that it can work in times of not just pandemics and lockdowns, but in times of disasters, in times of epidemics, droughts. How do we make NREGA more accessible and more easy to implement? And that is a learning that we need to carry forward. There was a mention of public transport, and this proved to be a very important thing. My earlier speaker did mention it, but I'm mentioning it in a different sense, that even public transport needs to be essential services, because we realized that even if you want to implement NREGA, or if you want, when the wage payments come in, how do I access banking services? If there is no public transport, how do I move to either the block level or the marketplace where there are kiosks, or where there are people, where there are business correspondents where I can go and withdraw money? And even if I withdraw money, where do I go and buy things if there is no public transport available? Even health services, the non-COVID health services were not accessible, because how do I go up to the sub-center or the health centers when public transport is not available? So there were a lot of issues related to making even NREJ work. But in spite of that, in spite of all these issues, in the particular last 2 years, and in the year when the budget outlay was 60,000 crores, during the finance minister's announcement in March end, it was increased to 1 lakh crores total. But actually, we ended up spending 1,11,000 crores. I mean, much more than what was anticipated. And after January, when the fund flow started slowing down, there was a virtual suppression of works to start anew. So NREJ could have helped in a much more way if it had been more flexible. So this brings us to the understanding of how do we make the usual procedures and processes of implementation change a little bit in times of such unusual circumstances. Second, in Maharashtra, we tried a small experiment with the rainfed agriculture network that we have in Maharashtra, because we realized that the small and marginal farmers, rainfed farmers, lack the even small amounts to buy anything like maybe seeds or maybe fertilizers that they wanted to buy for their Kharif in 2020 and 2021. There was no money in hand. There was no way to reach out to the markets. So we started online campaign saying what could be the low cost methods, what could be ways of making fertilizers in your villages by some youths coming together. So there were several ways in which what we call it Kharif campaign, we tried to reach out to small and marginal farmers, rainfed farmers, to make their own fertilizers, how to make seed treatment so that they can use seeds from home. So several such aspects of Kharif were taken up during this online consultations, online trainings, online meetings with all these community resource persons across Maharashtra. They did not belong to a particular organization. They belong to various organizations whom we reached out to, and we could make this work so that they could at least reduce their costs and continue with their work in Kharif. I also belong to a coalition, national coalition called RCRC, which in addition to other COVID relief works, what we did was we did a snapshot survey in May 2020 itself, trying to understand what are the issues at the ground level with the people, vulnerable groups that we work with. And we repeated that in August 2020, and we repeated that in January 21. This was across 11 states and around 10,000 to 15,000 families covered during these rounds that we did. And then the next round is underway right now. What did we learn from this? We learned several things, and that is of relevance here. The report is available on the website, so I won't go into it. But the kind of reports that we heard today are saying same things that we have seen several places, not just in 1 or 2 places, even if the studies were done in small groups. What we saw that food insecurity had increased in spite of the ration shops giving more free food. And 40% of our families said that there were times that they went hungry. There were times when they had to sell their own savings and assets to even cater to food availability at home. There were children who were like in 8th and 9th, and the parents said, now we don't think they will go back to school because now we need them to work and we can't hire labor because we can't pay labor. So these are very important insights that we learned. Women's issues did come up. They said, now work has increased at home because people have come back from the urban areas and they're staying here. So this is becoming very difficult for women who were there and who could not go out and work on Narega works, even if it started, because there was more work at home to cater to the entire families, which had increased. Maharashtra did come up with we worked a lot with Maharashtra Tribal Development Department to say that we need to support tribal families in some form. So they came up with two things: 2,000 rupees one-time DBT and 2,000 rupees worth of provisions. Now, the issue here I will bring is the issue of documents that are available with the families. And here we insisted with the Tribal Development Department that you will not ask whether they have any tribal certificate of being tribal or whatever. No, don't ask for any documents. As long as they live in a Gram Panchayat, which is dominated by tribal families, you have that data with you, you have a list of Gram Panchayats where most of the families, majority of the families are tribal, just include everybody in that Gram Panchayat. That is how we approached. It took a lot of time for it to go through the cabinet and the finance and all that, but it did come through, and they did come up with this Khawti program, which was eventually distributed. Another issue was this ashram schools. Residential schools of Social Welfare Department and Tribal Development Department were closed down, which also meant that the food that was being given to these children in these schools and hostels was denied. It was not available to them, which also meant that the food insecurity at home had increased. But this was not considered when we were doing calculations for what ration needs to be increased. So it was a very ad hoc way of saying 5 kgs per family per month. Where is the calculation? What are we saying? We have reduced costs on some other things which government was spending for its own people, and why are we not distributing the same into their families? So this kind of disconnect could be seen at the ground level. One interlinkage that I would like to highlight here, because I am dropping out all the points that have already been covered, is that the ICDS workers always used to tell us in the villages that if NREGA works don't start, then in December, migration starts. So families go with their children, they migrate, they come back in June. So whatever efforts we take between June and November for the children to come out of malnutrition and get into the list where they are not malnourished, they go in December, come back in June, going back to what they were in last June. So when we talk about nutrition programs, when we talk about food insecurities, NREGA is not just a wage program. NREGA is not just a rural livelihood program where assets are created. Because of NREGA, migration, especially long-term migration, can be reduced. And the other programs of the government, which are meant for the families, anemia in women, malnourishment in children, have direct correlation to NREGA working in those villages. So we need to consider all this when we are thinking about an integrated approach to all this. Another thing that comes to our mind is when we talk about information, we should realize that even the government was caught off guard and they did not have the information. They did not have the architecture to understand what kind of information needs to be gathered. So we need to understand all this. And lastly, I would like to say that it was not just the availability of data or the missing data that we realized, but linking data was also very difficult. We were trying to talk with the government that take a list of your PDS people, your NREGA people, your pensioners, and can you all link all these together to see who in your basket right now are vulnerable? In your own basket. Forget the missing people. We don't even know them. That will become a step 2. But in step 1, you do not have an integrated list of all the vulnerable families that your programs are meant to reach out to. So this is something that we all need to think. See, in all that we have been talking just here with the people that we are talking with, we see that there are so many complexities related to social protection, be it women, be it children, be it the region that they belong to, be the caste that they belong to, the kind of works that they do, their professions, migrants. There are, plethora of complexities involved in this. Now, if we keep talking about these complexities, the immediate answer, which could be very easy and simple for any government response, would be just income support. Now, if there is a response like this, we need to do our homework. We need to come up with a studied response to this That I think is one of the things that a platform like this can really come up with. And in all this, we need to realize the circumstances, the context of the economic growth going down, the economic slowdown is there, job growth scene is really in bad shape, manufacturing sector is in bad shape, inflation is going high, since yesterday it has again increased, and public investments have actually decreased. If you really see the union budget of this year, public investments, especially for such programs and schemes, has decreased when the need is highest. So how do we put all this together? How do we create a metadata report of, maybe it is the Ajim Premji report, RCRC report, or the reports that we've seen today? There are at least a dozen reports out there telling us what the problems are. How do we create a metadata of this and create a report of understanding all the complexities, and ultimately create spaces for interactions between practitioners, academic researchers who are doing the kind of work that we are looking forward to, the policymakers, the government, and the collectives who will ultimately make it work. So how can we bring all these stakeholders together is something I think this platform can really address. I will stop here. Thank you.
Thank you, Ashwini, for a very detailed and very comprehensive presentation of the issues as well as the challenges that we face on ground. I am given to understand that the government representatives who were supposed to join us are not able to join us. So instead of summarizing what the eminent speakers have spoken about, I'll just add a couple of points to what they have already shared. I think Dr. Abhay has very categorically talked about convergence, not just between the civil society organizations and the government agencies, but also a larger and broader convergence at the community level, and how more alliances could be formed, convergent approaches could be used between the people, the communities, the civil society organizations, and the government, so that we can really bridge the gap between the realities on ground and the policy responses. So this is something which I think is very important, and we should not lose sight of that. Then of course he spoke about the lack of political will, and I think that is something which is very critical, because we as civil society organizations, we also have to in a way take a call someday where exactly we want to be facing, where exactly we want to focus our attention, where exactly we want to focus our energies, and where we want to really invest. So I think the civil society organizations really also have to ask this difficult question of themselves and find some answers to this. And then one important issue which Abhay spoke about, and I agree with him 100%, reclaiming public services. And in today's times, especially during the COVID, what we have witnessed is an obscene rise in income and wealth inequalities in this country. And then the policy response which we find in the post-pandemic era is more and more privatization of public services in the name of efficiency. And how do we really deal with this issue? And how do we, in a way, create political will? How do we mobilize people? How do we generate public demand to reclaim public policies? I think this is one important message that probably the civil society organizations need to share with as many people as possible. I think, the way Ashwini laid this entire canvas before us, I think what is really required probably may not fit in the scope of this particular conversation of today's, but we cannot lose sight of the fact that there needs to be a complete rehaul and re-envisioning of rural economies. How are we going to reorganize rural economies? That is one of the biggest challenges that probably we will face, not immediately today, but probably in the years to come. Because if I'm not mistaken, there was reports during the pandemic, due to this reverse migration, almost the rural India witnessed a 5% rise in the population. So what it means is there is 5% increased burden on the resources in the rural economies, more demand for schemes like NREGA, more pressure on public health services which are already in dilapidated situations in the rural areas. So this increased pressure on rural economies, increased pressure on the rural systems. So that is the reality in which we are living right now. And even though we find that migration now is going back to its pre-pandemic level, there is a lot of uncertainty in the minds of people who usually migrate for livelihood. So probably now we will have to wait and see how the things unfold. But my gut feeling is that probably it will be more of a seasonal migration henceforth, and people will be more dependent on the rural economies back home. So how do we really try and put our forces together in re-envisioning and rebuilding, reorganizing rural economies? Because a lot of pressure was created, and the rural economies really responded to the occasion. So that we will need to keep in mind. One thing which I would request everybody to think about is when we are thinking about this convergence between government and civil society organizations. I think one important message that we are getting from this consultation, especially this second session, is lack of data and information. We also find when we are working on the ground that the data that we collect is not the data which the government accepts, and there is a lot of I would say inconvenience for the government to accept data which is actually generated through the civil society work. So there has to be some kind of more open data sharing, more open and more robust ways of collecting data, which I usually call as building some kind of people's data. So whether we can do some beginning on that front. So that is something which I think we really need to think about. Second is, how do we really build, taking from what Yoon said, not just the knowledge networks, but also knowledge action networks. How do we, there are many stories which we all have documented during the pandemic, after the pandemic. How do we bring these stories together, and whether we are able to create a bigger narrative out of it? So how do we connect these different dots? Because there have been different responses by people, many positive, many promising responses. So how do we really bring these together, and how do we make a kind of a larger narrative which can offer really good policy solutions, and which will pave the way for better convergent approaches? Anyway, so I would like to leave everybody with this. Thank you very much, especially in this panel, for sharing their views and bringing many important issues in the discussion. I think we have got some pointers for the next session that is on the way forward. So thank you once again, YUVA and UNICEF, for having this conversation and inviting us for participating in this and sharing our views. So thank you. Over to you, Roshni. Thank you.
Thanks so much, Amit. And thank you, everybody, all the panelists, Dr. Abhay, Santosh, and Ashwini Tai. I think very, very incisive points. And it's interesting, none of you, you all covered a huge gamut. There was no repetition, but I think the need for the political will, I think that also came across very strongly, and civil society's role in enabling that. I think that is really, as Amit said, it's really once again bringing to light the need for us to somehow find a way to come together and really, work in Maharashtra. And I thank you to everybody who's also contributing to the chat. I know it's always challenging to listen and contribute, but very lively conversations happening. So I really appreciate all of your investment in that as well. We are running a little late, I'm sorry. So I will request, and I know some people do have to go, but we will have the final session, which we are trying to have more of an open conversation. And there are many people who have requested us to, already to share their thoughts. So we will go a little over 1:30. I hope we can finish by maybe 1:45, because we are 15 minutes running a little late. And hopefully we'll be able to cover in everybody's points. To manage anchor this discussion session, I would request Rajendra Bhise, who is our colleague, and many of you know him. He's a veteran activist in the Maharashtra space. He has been with YUVA for several years, and he's also currently the General Secretary of the Working People's Charter, which is a very important convening, in the country as well as in Maharashtra. So I request Raju ji, aap aake thoda ye session ko anchor kijiye. The way we are looking at this, Raju will open a little bit, and then he will invite people to speak. So Raju.
Thank you, Roshni. एक्चुअली ये जो सोशल प्रोटेक्शन का जो भी लैंडस्केप है, तो पूरे सेशन में काफी स्टैटिस्टिक अप्रोच अलग अलग चीजों की बात रखी गई है। मैं ज्यादा बात नहीं करूंगा, लेकिन बाकी जो लोग हैं वो उनको बात करने के लिए स्पेस दूंगा, और कुछ मुद्दे अगर रहे तो फिर लास्ट में मैं उसको बात रखने की कोशिश करूंगा। बेसिकली ये जो सेशन है, ये सेशन में खास स्ट्रेटेजीज के ऊपर अगर इफेक्टिव स्ट्रेटेजीज के ऊपर अगर इनपुट आ सकते हैं तो अच्छा रहेगा कि हम इसको थोड़ा आगे बढ़ा सकते हैं। मैं निसरीन जो है रंगूनवाला से, उनको इनवाइट कर रहा हूँ कि वो बात रखे। और ये जो क्योंकि समय कम है और काफी सारे लोगों को बात करने के लिए इनवाइट करना है, तो 2 से 3 मिनट में अगर आप आपके इनपुट सजेशंस दे सकते हैं तो अच्छा रहेगा। तो नसरीन।
Yeah, thank you, Raju. Thank you, Roshni. I think way forward, quite a few things could be drawn from the very fruitful and enriching discussion that can't. Hello.
हाँ, आवाज आ रहा है, बोलिए।
आ रहा है ना? Okay. Yeah. So when one is talking of way forward, I think one will also have to draw from the enriching discussion that we had since the morning. 2, 3, a couple of points that maybe more than a couple that I would like to put forth is, and it's also drawing from what has already been said, is okay, one is the huge invisible population that we have, which is not accessible and who can't access their entitlements. So I think that needs to be addressed in a very proactive manner by government and through whatever, whether it's like Abhay said, public partnerships or public-private partnerships, and that I think can be linked to database and an MIS system, and proactively reaching people at the grassroots level or at the basti level. And we have government mechanisms, whether you use your Anganwadis or you use your health posts or you use your ward offices, the existing data and the ground level data, and proactively reach people. I think that's very important, because the schemes are there. I think a lot of work is being done at the policy level, but how does it percolate to the beneficiary, and how does the beneficiary access that? One is in terms of information and one is in terms of actually getting the benefits. And this whole concern also about the high, I think this digitization, if one simply takes the example of the NETP program, the tuberculosis program, and the 500 rupees that a person is entitled to as Nikshay Poshan Yojana, and as direct bank transfers, even in the urban space, we see that people are not getting it, and it is not accessible. So somewhere, I think to create those mechanisms where people, one is that, yes, at a policy level, what changes that one has to bring in, but second is to create a pressure to access what already exists. And that itself will sharpen the gaps. I think that is something that one has to work towards. In terms of government schemes like the Ayushman Bharat, which is a national scheme, and then there is a state scheme like in Maharashtra, if you have the Mahatma Jyotiba Phule scheme. Now, one is that integration of schemes, but for Maharashtra, if one is accessing the Ayushman Bharat, then the state scheme, there is a cutoff. But then is that happening across all states is something that needs to be looked into, so that there is a lot of congruence in terms of going forward at a national level, portability of schemes. I think a lot of synergy and congruence work also needs to be looked into. one when talks of ration cards, it's not only linked to the public distribution system, but today a ration card is I think your passport or your gateway to a lot of entitlements, a lot of schemes. So one nation, one ration card, of course, I think when it comes to actually accessing it at the grassroots level, it's going to take a lot of time. But I think people hold on to their native ration cards due to property or even other issues. So somewhere to bring it that mechanism as to where is that document in terms of accessibility to other schemes, and where is that document, what is the functionality in terms of the public distribution system and access to ration per se. There is a gender issue also as far as ration cards are concerned, and how I think what we need to put our minds to is to address that in terms of widows, in terms of joint families, in terms of like conflict in families. Women simply get blocked out of access to their entitlements. I'm sure I have a lot of other points, but with the time constraints, I'll stop here. And I'm sure that others will cover a few other points.
थैंक यू निसरीन. आपने काफी जो इनविजिबल पॉपुलेशन का जो मुद्दा है वो काफी मुझे लगता है काफी इम्पोर्टेंस है और वो डाटा क्रिएशन के साथ कैसे लिंक कर सकते हैं. मैं अभी क्रांति जो HRLN से है उनको इनवाइट कर रहा हूँ. 2 या 3 मिनट्स में आप.
राजू जी शुक्रिया. मैं बहुत जल्दी अपना पॉइंट सामने रखने का कोशिश करूंगा. सिर्फ 2 पॉइंट हैं. पहला वाला जो है, द फर्स्ट पॉइंट, आई थिंक दैट द presentations were brilliant in their detail. Some reinforce what our understanding of the situation has been. Some are new learnings. But one of the areas I think that it would do us good to also acknowledge is that the courtroom has been a space where it has it's been a potential space to influence the rights of children. And numerous cases have existed before the COVID times where it went into fine details as to what children should be getting, whether it was food, whether it was social security schemes, whether it was child sexual abuse matters, the procedures to be followed, access to education, in fine details. And it has been one arena that has been highly underutilized during the COVID times. I am not, that said, I'm not, it's not easy for me to say that we should be accessing the courtrooms because it's been a challenging environment. But it is an area where in terms of fine detail as well as macro policy issue, there is great potential, and there are a lot of cases that go on and that influences the lives of children. That is one part. पर जो दूसरा चीज जो जिसके बारे में मुझे ये बात करना है वो ये है कि सभी स्पीकर्स ने बहुत सारे स्कीम्स का वर्णन किया है और हम कन्वर्जेंस की बात कर रहे हैं और एक चैलेंज रहा है कि उसका इम्प्लीमेंटेशन कैसे होगा. और जो भी केसेस कोर्ट में भी आ रहे हैं, हमने ये देखा है कि सबसे ज़्यादा इफेक्ट आपको ज़मीन पे वहाँ दिखता है जहाँ लोग संगठित हैं. एंड मोस्ट स्कीम्स फॉर सिविल सोसाइटी एज वेल एज फॉर द गवर्नमेंट we've realized that they really matter. It's not about whether it's a case in the court or whether there are organizations there to make it happen. What really matters is if we manage to invest in people organizing themselves and articulating the rights of themselves, of the community and the children. And that is something that like even Abhay was saying, it's something that those are the learnings that we have to keep, and that is exactly why those schemes get so underfunded, or those participative processes or those participative aspects of the scheme. And I think that is something that we really need to keep reinforcing and asking for, because if you want to affect rights, the decentralization and the devolution of accountability has to happen. You have organizations today, you won't have organizations tomorrow, but the people will be there, and that's going to really be the key to making anything happen on the ground. Thank you, Raju ji.
थैंक्स क्रांति. खासकर जुडिशरी सिस्टम के अंदर जो इश्यूज है और चैलेंजेस है उसके बारे में आपने बात रखी, और कन्वर्जन के बारे में जो इफेक्टिव इम्प्लीमेंटेशन के कॉन्टेक्स्ट में जो कन्वर्जेंस है इसको भी एक इम्पोर्टेंस आपने दिया है। मैं इसके आगे प्रज्ञा दासरवार यशदा से है, उनको इनवाइट कर। प्रज्ञा है यहाँ पे? ओके, प्रज्ञा नहीं दिख रही है। संध्या अय्यर जी TISS है।
नमस्कार एंड थैंक यू राजू जी टू गिव मी द चांस। आई डोंट नो मेरा ऑडियो आपको सुनाई दे रहा है? मेरा, कैन यू हियर मी?
Yes.
And I would like to thank YUVA and UNICEF for organizing this very, very important discussion, and thanks for making it so relevant. Hello? Hello?
We can hear you, Sandhya.
Yeah, we can.
आवाज आ रही है, बोलिए
Thank
बोलिए,
you.
आवाज आ रही
नहीं, जैसे अभी के स्पीकर्स ने कहा कि हमें एक चीज याद रखनी है कि स्कीम्स को जहां हमें स्ट्रेंथन करने की बात कर रहे हैं और जहां पे हम कन्वर्जेंस की बातें कर रहे हैं, एक बहुत ही अहम मुद्दा जो हमको याद रखना है कि ये जो वन साइज फिट्स ऑल वाला स्ट्रैटेजी है कि सभी जगह पे हमें शायद पब्लिक प्राइवेट पार्टनरशिप्स एक्सपेरिमेंट करने चाहिए या कहीं ना कहीं हमको प्राइवेट सेक्टर लाना चाहिए, ये तो होने से रहा, बिकॉज एवरी रीजन एवरी ब्लॉक इज वेरी डिफरेंट। और दूसरी बात ये है कि जब हम शिशुओं की बात करते हैं, जब एजुकेशन, हेल्थ, न्यूट्रिशन, राइट्स की बात करते हैं, अगर हम बच्चों को सेंट्रिक फ्रेमवर्क्स देखते हैं तो यहाँ पे कन्वर्जेंस किस तरह से कर पाएंगे? I think there are two very important things which come out from the findings of the study, also from the social protection network perspective, is that there is very different experiences that we see in the tribal dominated areas vis-a-vis those where you find the scheduled caste dominance is very, very high. I think हमें इस बात को रखना है कि ट्राइबल डोमिनेटेड रीजन्स में शायद हमारे पास इतने संगठन भले ही हों लेकिन वो इतने डिस्पर्स है तो हम उनको कैसे एक्सेस कर पाएंगे? सेकेंडली, अगर हम ट्राइबल्स अगर शेड्यूल कास्ट के लिए करने जाते हैं तो यहाँ पे ये इश्यू है कि हेट्रोजेनिटी इतनी डाइवर्स है कि नॉट ऑल आर लिंक्ड टू अ सिविल सोसाइटी। डज इट मीन दैट प्रोग्राम्स कैन बी इम्प्लीमेंटेड? हमारे स्टडी में हमने ये देखा है कि कन्वर्जेंस इज नॉट सो मच अबाउट implementation, it is also from the concept of designing. एक एग्जाम्पल मैं आपको देती हूँ। लास्ट ईयर ट्राइबल प्लान में डिस्ट्रीब्यूशन ऑफ साइकिल्स के ऊपर काफी एम्फोसिस किया गया था, तकरीबन 200 करोड़ एलोकेट किए गए थे। अब उसमें से only about 40% students have got benefited. Even if I upscale the budget, okay, do I really know how I have to implement it for the remaining children, and is it about only distribution of cycles? क्योंकि यदि हमें अभी ये जो डेटा हमें अजय जी ने दिखाई है और we were talking about the children who have lost out parents, we have to talk about newer ways of reaching out. ये reach out के लिए हमें ग्राम पंचायत को strengthen करना है, हमें local communities को strengthen करनी है, और even ये जो बहुत important बात कही गई थी कि slum versus non-slum, इस तरह का जो हम लोग बाइनरीज में जी रहे हैं, हमें उन बाइनरीज को तोड़ना होगा। हमें बच्चों को मद्देनजर रखना है and we have to run the structures. Education has been the most impacted in the COVID framework, where schools didn't reopen and there was a lot of fear about what will happen. हर जगह बार बार हम बच्चों को ही एलियनेट कर रहे थे हमारे फ्रेमवर्क में, और अगर यही चलता रहा, we will never be able to catch up. Do we have an additional strategy of how do we make everything scaled up to a significant point? If I talk to government officials, again, I'm giving a very localized block level understanding over here. They are still not able to imagine कि बच्चों के अगर पहुंचाना है तो स्कूल नहीं, गांव तक पहुंचाना है, हमको गांव तक सर्विसेज देने हैं। अभी भी ये इंस्टीट्यूशनल स्ट्रक्चर के अंदर ही काम किया जा रहा है। वो जो फियर है कि हमको अगर हम अगर क्राउडेड एरियाज में जाएंगे तो कुछ हो जाएगा, ये बच्चों में सीमित नहीं है ना, वो तो कामगारों पर भी सीमित है। तो वी नीड टू काइंड ऑफ अपस्केल आवर अंडरस्टैंडिंग। सो टू वेरी वेरी इंपॉर्टेंट पॉइंट्स, वन साइज फिट्स ऑल in frameworks will not work for convergence anymore. Secondly, if I want to work on child development and child rights, I have to keep the child at the center, and therefore I have to bring it to the village or the community at that juncture. Not all communities have access to civil society. Not all communities have access to markets. The only thing they have access to is the government provisioning. How do I make the last mile connectivity? I think Rajendra ji, इस पे हमें काफी डिबेट करना है कि last mile connectivity of schemes कैसे करें। और स्कीम्स बढ़ाए कि जो स्कीम्स है उसको और भी स्ट्रेंथन करे. I think we have to start talking about strengthening implementation than creating more programs. Thank you.
थैंक्स संध्या जी. आपने काफी अहम मुद्दा रखा है कि सोशल प्रोटेक्शन का डिजाइन का जो महत्व है, खासकर सोशल प्रोटेक्शन को फ्रेम करने से लेके एग्जीक्यूशन तक, वो काफी महत्वपूर्ण मुद्दा है. उसको हम चर्चा और डिबेट में आगे ले सकते हैं. अभी आगे बात रखने के लिए मैं अभय पेठे जी से पेठे जी को आमंत्रित कर रहा हूँ. अभय पेठे 2-3 मिनट में वो अपनी बात रखें.
I think he had to move out for some other meeting, so he is going to send the inputs later.
Okay, thanks. मैं चंदन को इनवाइट कर रहा हूँ. चंदन वर्किंग पीपल्स कोएलिशन के है, वो अपनी बात रखें 2 से 3 मिनट में.
ओके.
चंदन है?
हाँ राजू भाई, आप मेरी आवाज सुन पा रहे हैं क्या?
यस बात.
ओके. मुझे मरीना ने बोला मुझे कि कुछ वर्कर्स राइट से कुछ हैमरिंग पॉइंट्स बोलने हैं, तो मैं कोशिश करता हूं कि वो 2 मिनट में हैमरिंग पॉइंट्स बोलने की कोशिश करता हूं. बहुत बहुत धन्यवाद युवा के सारे साथियों को इस अवसर के लिए. मैं थोड़ा सा अगर मैं जो बोलूंगा हो सकता है थोड़ा ऑफ द ट्रैक में लगे, बिकॉज बच्चों के लेंस से बात हो रही थी और मैं काफी देर से कॉन्वर्सेशन सुन रहा था, तो हो सकता है थोड़ा ऑफ द ट्रैक हो, इसके लिए मैं माफी चाहूंगा. लेकिन मैं थोड़ा सा पॉलिटिकली काफी समस्याएं हैं इस पूरे, हम वर्ल्ड ऑफ वर्क की बात कर रहे हैं, वर्ल्ड ऑफ स्कीम्स की बात हो रही है. ऐसा लग रहा है कि पूरा सरकार ने हमको एक बेनिफिशियरीज बना दिया है, जबकि हमें राइट्स होल्डर होना चाहिए. हम बेनिफिशियरीज बन गए हैं और एक पूरा बूफे लगा हुआ है. ऐसा लगता है, अभी मैं बूफे का लिस्ट पढ़ रहा था कि सरकार ने अभी सारे वो बूफे स्कीम्स को उठा करके ई श्रम के अंदर लेकर के आने की कोशिश कर रहे हैं, और करीब 20 स्कीम्स हैं. प्रधानमंत्री श्रम योगी मानधन योजना से लेके पेंशन स्कीम, जीवन ज्योति योजना, प्रधानमंत्री सुरक्षा बीमा योजना, आयुष्मान भारत, सफाई कर्मचारी फाइनेंस डेवलपमेंट कॉर्पोरेशन, अटल पेंशन योजना, पीडीएस, प्रधानमंत्री आवास योजना, सोशल असिस्टेंस प्रोग्राम, ओल्ड एज पेंशन, हेल्थ इंश्योरेंस, सेल्फ एम्प्लॉयड स्कीम, पूरा बूफे लगा हुआ है. मेरा ये कहना है कि इस बूफे से थोड़ा हम बाहर निकले, और अगर हम एज ए राइट्स होल्डर के रूप में अगर अपनी बात को समझे, तो मुझे लगता है कि हमारा एक डायरेक्शन बहुत क्लियर होगा. हिंदुस्तान के किसी कानून में कोई सोशल प्रोटेक्शन जैसी कोई डेफिनेशन भाषा नहीं है कि सोशल प्रोटेक्शन, ऐसे कोई लीगल टर्मिनोलॉजीज नहीं है. लेकिन इंटरनेशनल ऑर्गेनाइजेशन, जैसे अगर मैं ILO की बात करूं, वर्ल्ड बैंक की बात करूं, एशियन डेवलपमेंट बैंक की बात करूं, तो मल्टीनेशनल बैंक्स, इंस्टीट्यूशनल बैंक्स, ILO, UN के एजेंसीज जैसे यूनिसेफ, उनकी भाषा है सोशल प्रोटेक्शन को लेकर के, और वो बहुत ब्रॉड डेफिनेशन है. उसमें क्लाइमेट, पब्लिक सर्विसेज, लेबर, बहुत सारे एक बहुत ब्रॉड डेफिनेशंस हैं. अब उन ब्रॉड डेफिनेशंस को हम हिंदुस्तान के लीगल सिस्टम में कितना एम्बेड करेंगे, वो एक बड़ा सवाल है, उस पर हमें सोचने की आवश्यकता है. लेकिन मैं थोड़ा लेबर के लेंस से बहुत कॉन्क्रीट होकर 2-3 सुझाव देना चाहूंगा, और उस पर अपनी बात भी रखना चाहूंगा कि सोशल प्रोटेक्शन का जो ILO का कन्वेंशन है, उसके अंदर में 2 बड़ी चीजें हैं. जो सोशल प्रोटेक्शन ILO का कन्वेंशन के में ये कहा भी गया कि एक ILO का कन्वेंशन है 102, जो कन्वेंशन नंबर 102 है, और उसके अंदर में ही हिंदुस्तान का लीगल सिस्टम है. उसको 1952 में कन्वेंशन लाया गया, और उसमें एक 9 इंडिकेटर्स ऑफ सोशल सिक्योरिटी की बात कही गई है. तो सोशल प्रोटेक्शन के अंदर सोशल सिक्योरिटी की बात कही गई है, और मेडिकल बेनिफिट्स, सिकनेस बेनिफिट्स, अनएम्प्लॉयमेंट बेनिफिट्स, ओल्ड एज बेनिफिट्स, एम्प्लॉयमेंट इंजरीज, फैमिली बेनिफिट्स, मैटरनिटी बेनिफिट्स, इनवैलिडिटी बेनिफिट्स एंड सर्वाइवल बेनिफिट्स. तो ये 9 इंडिकेटर्स ने ILO ने लिस्ट डाउन किया है एज फार एज द डेफिनेशन ऑफ सोशल प्रोटेक्शन इज कंसर्न. तो लेकिन ये हिस्टोरिकली बात ये हुई कि क्या हमारे जितने भी ग्लोबल साउथ या जितनी छोटी इकोनॉमीज हैं, कंट्री लाइक इंडिया, क्या उनके पास इतना पैसा है, क्या वो इन सोशल सिक्योरिटी को फिनेंस कर सकते हैं क्या? तो ये बात हुई कि नहीं कर सकते हैं, मतलब वो हमारी जो इकोनॉमिकल हालत में नहीं कर पाएंगे. तो 2012 में एक फ्लोर की बात कही गई कि एक सोशल प्रोटेक्शन फ्लोर हो सकता है, एक सोशल सिक्योरिटी फ्लोर हो सकता है, और उसको इंडिया ने फिर इसको अडॉप्ट किया, रेटिफाई किया, रिकमेंडेशन नंबर 202. और ये जब कानून बना 2008 में अनऑर्गेनाइज्ड वर्कर सोशल सिक्योरिटी एक्ट, तो वहां एक मिनिमम सोशल सिक्योरिटी को तय किया गया जिसमें ओल्ड एज पेंशन, मैटरनिटी, हेल्थ और वर्कर्स आईडी कार्ड, इसको इंश्योर किया गया, और उसके बावजूद भी हिंदुस्तान ने उसको अचीव नहीं किया। हमने एक छोटा कैलकुलेशन किया था कि अगर आपको ये देना है, पूरे भारत में जितने भी मजदूर हैं जिसकी संख्या करीब करीब 44 करोड़ के आसपास में है, अगर उनको देना है तो 2.17% जीडीपी के खर्च पड़ेगी, लेकिन सरकार ने कहा कि ये भी नहीं दे सकते। तो ये बहुत बड़ी विडंबना है हमारे सामने में कि पूरा इनफॉर्मल वर्कर, जहां सारे बच्चे, पूरे अर्बन वर्कफोर्स की हम बात कर रहे हैं, फोकस होकर के, जो एक पूरा सेक्टर जो हिंदुस्तान की करीब करीब 1/3 आबादी है और जो देश के जीडीपी में 60% कंट्रीब्यूट करता है, उसके लिए सरकार 2% जीडीपी भी देने को तैयार नहीं है। और एग्जैक्टली दिस इज व्हाट हैपेंड। कोविड में भी हमने वही देखा कि लोगों के जॉब लॉसेस हुए। मैं बच्चों की बात पे ऑलरेडी बहुत सारी बातें हुई हैं, लेकिन स्पेशली द इनफॉर्मल वर्कर्स, डोमेस्टिक वर्कर्स, स्ट्रीट वेंडर्स, नाका वर्कर्स, कंस्ट्रक्शन वर्कर्स, वर्कर्स हु आर इन द एमएसएमई सेक्टर, वर्कर्स who are kind of all kind of employment, तो उनको लेकर के अगर हमें आज ये बात करनी है तो मुझे लगता है कि we need to really think about that what could be the rights perspective and workers lens, उनको हमको डिमांड करना चाहिए। बहुत बहुत धन्यवाद। थैंक यू राजू भाई।
थैंक यू चंदन, वर्कर्स पर्सपेक्टिव रखने के लिए। मैं अभी मोहा निगुड़कर जो है उनको आमंत्रित कर रहा हूँ कि 2 या 3 मिनट में वो अपनी बात रखें। मोहा।
Yes, thank you. And I have just 2-3 points. एक तो है कि lot of researches are happening, lot of evidence is getting generated, but who owns the findings? Finally, all the recommendations which come forth, unless and until each and every of those recommendations are then discussed threadbare and integrated into policies and schemes, they remain as excellent research reports, but thereafter the next step does not happen as effectively as the efforts that would have gone on into creating the research report. So my first suggestion is that for these enriching processes, and we've all learned so much in today's webinar, that some of the seminars could be also around research based evidence which has emerged out of research, and how have those recommendations been taken forth? How have they been institutionalized in subsequent policies and schemes and processes? Then that will also become a huge learning for us, that what do we do with the recommendations that have come out. Second is that convergence is inherently an institutional response, a systemic response, and the work that is happening across different stakeholders, that will need to continue, because unless and until the ownership is with the state, the large scale impact that we are looking forward to may not happen to the extent that we are all hoping it will happen. My third point is that when we are working with the life cycle approach, and we learned so much about social protection also, within that life cycle approach, child protection, while integration is an excellent idea, the uniqueness of the unique needs and certain child protection needs are very unique to certain groups of children within the whole discourse of child protection, and that should not get subsumed under the larger discourse of social protection. So while I do agree that health, education, nutrition, these are universal and they impact all the children, but there are certain issues which are very unique to certain groups of children, which Mr. Santosh has brought out, some of the groups are very well. So child protection needs to remain as a very independent entity within the larger discourse of social protection. Last 2 points, and I will stop here. The family context in child vulnerability plays out very differently depending on the situation that the child is in. So the family context in child vulnerability will be very different in a case of child trafficking vis-a-vis a child marriage or a child labor or a street living child. So some of our discussions, more in-depth discussions, can happen around the family context in child vulnerability when we are looking at child protection issues, and not under the larger framework of family and livelihood. And of course, if benefits go to the family, it will go to the child, but it doesn't automatically happen. So systems have to be institutionalized that those benefits reach the children also. My last point, a lot of discussion has happened around data and the need for updated data, but we need to go into the micro details. Where is it? Where are the bottlenecks? Not enough computers, not enough connectivity, not enough people to upload the data. Some of them do not know what is the information that has to go up. So unless and until we go into the micro processes of these larger macro contexts that we are talking about in terms of better implementation or need for better convergence. And I'll end here that the nitty-gritties of where are the bottlenecks and how do we then go into those micro details would go a long way in building up that larger macro scenario that we are talking about. I will end here now. Thank you.
थैंक मुआ जी। मैं अभी श्वेता को बुला रहा हूँ, श्वेता हलवा। वो अपनी बात जो है 2 या 3 मिनट में रखे। श्वेता है यहाँ?
हाँ है, हूँ राजू दादा।
बोलो बात रखो।
Thank you, YUVA and UNICEF, for organizing this webinar. It has been very informative all through. I missed the initial part of the study presentation, लेकिन उसके बाद जो डॉक्टर अभय शुक्ला के presentation से जो सुना है मैंने, वो काफी उन बहुत सारे मुद्दों से मैं I agree with them. मुझे जो लोगों ने कहा है उसी को थोड़ा सा स्ट्रक्चर में डाल करके मुझे थोड़ी सी बात रखनी है, 2-3 मिनट लगेंगे। कि अभी एक अपॉर्चुन मौका है जब हम यूनिवर्सलाइजेशन की बात करें और यूनिवर्सलाइजेशन ऑफ हेल्थ, यूनिवर्सलाइजेशन ऑफ ESIC, यूनिवर्सलाइजेशन ऑफ EPFO, इन तीनों को हम अगर साथ में ला सके तो एक ऐसा स्ट्रक्चर हमको मिलता है, सोशल स्ट्रक्चर मिलता है जहां बाय डिफॉल्ट अ चाइल्ड गेट्स प्रोटेक्टेड। साथ ही साथ ये करना जरूरी है क्योंकि वी हैव अ ह्यूज इनफॉर्मल पॉपुलेशन व्हिच इज अनप्रोटेक्टेड एंड व्हिच हैज इट इज एविडेंट दैट सबसे ज्यादा सोशल प्रोटेक्शन की उनको जरूरत है। और बाय डिफॉल्ट अगर उनको प्रोटेक्ट किया जाए तो उनके परिवार में उनके बच्चों को भी प्रोटेक्ट उनके बच्चे भी प्रोटेक्टेड रहेंगे। साथ ही साथ बहुत जरूरी है कि ये जो 2 साल जिसने पूरा लाइफ डिसरप्ट किया है उसको हम अपने एजुकेशन के न्यूअर डिमांड्स में आर्टिकुलेट कर पाएं और जो प्रोग्राम्स जिनकी फंडिंग अब बिल्कुल ही कम हो गई है उनको हमको रिविजिट करने की जरूरत है या वो नॉन एग्जिस्टेंट हो गई हैं बहुत से जगह पे। तो स्पेशली ऐसा देखा जा रहा है कि बहुत सारे बच्चे जो हैं वो कॉम्प्रिहेंशन और उनका रीडिंग और राइटिंग स्किल्स नील हो गया। ये मैं बड़े बच्चों की भी बात कर, बड़े बच्चे मतलब जो एडोलेसेंस में हैं उनकी भी बात कर रही हूँ। और ये बहुत जरूरी है कि उनको एक इनपुट्स दिए जाएं, उनको स्कूल के जरिए इनपुट्स दिए जाएं। तो इसलिए सर्व शिक्षा अभियान में जो इसकी बात थी, क्या बोलते हैं, ब्रिज क्लासेस की बात थी, तो उसको हमको वापस लाने की जरूरत उस तरह के इसको लाने बात नहीं। सारे बच्चे जो ड्रॉप आउट हो करके ट्रांजिशन हो गए हैं, जो 18 साल से बड़े हो गए हैं और जो ऑलरेडी लेबर में चले गए हैं, बहुत जरूरी है कि उनको क्योंकि अब वो वर्क पार्टिसिपेशन में है तो उनका प्रोटेक्शन होने की जरूरत है, उनका स्किल अपग्रेडेशन होने की जरूरत है और बहुत से ऐसे एवेन्यूज होने चाहिए जहां पे उनके लर्निंग्स को एनहांस किया जाए। साथ ही साथ देयर इज अ लॉट ऑफ मेंटल ट्रॉमा जो हेल्थ का एक इंटीग्रेटेड पार्ट होना चाहिए। द यूनिवर्सलाइजेशन ऑफ मेंटल हेल्थ कैसे हम कर सकेंगे उसकी बात करनी चाहिए। और ये मेरा आखिरी मुद्दा है कि इस पूरे प्रोसेस में हमने ये देखा है कि स्लम्स स्पेशली जो अर्बन कॉन्टेक्स्ट में जो है हाउसिंग, ये एक बहुत बड़ा हाउसिंग या हाउसिंग का न होना ये एक बहुत बड़ा डिसएडवांटेज है खुद को प्रोटेक्ट करने के लिए। तो जितना न्यूट्रिशन जरूरी है, जितना एजुकेशन जरूरी है, जितना प्रोटेक्शन मैकेनिज्म जरूरी है, लॉ एंड ऑर्डर जरूरी है, उतना ही हाउसिंग बहुत जरूरी है। एंड इट इज वेरी वेरी इम्पोर्टेंट, इट इज वेरी वेरी इम्पोर्टेंट दैट हम हाउसिंग के डिमांड्स को फिर से आर्टिकुलेट करके उनको आगे लाए, और जिस तरह के प्रोग्राम्स अभी तक इम्प्लीमेंट किए हैं उनके जो डेफिसिट्स हैं उनको हम हाईलाइट करें और हम इसको सामने लाने की कोशिश करें। और अब एक लेंस नहीं हो सकता है, हेल्थ का लेंस होना होगा, एनवायरमेंट का
थोड़ा
एनवायरमेंट का लेंस होना होगा। और एक आखिरी पॉइंट कि इस पूरे 2 साल के प्रक्रिया में जो डिसएडवांटेज में महिलाएं रही हैं, महिला वर्कर्स रही हैं, उन वर्कर्स को आगे लाने के लिए, क्योंकि बहुत सारा बड़ा वर्कफोर्स था जो होम बेस्ड वर्क में एम्प्लॉयड था, जिनके सप्लाई चेन्स डिसरप्ट हो गए, बहुत सारे नए एम्प्लॉयमेंट में आए हैं, इन सबको प्रोटेक्ट करने की बहुत जरूरत है और इन सबको वर्कफोर्स में इंटीग्रेट करने की जरूरत है। तो नए वर्क फॉर्म्स को समझने की जरूरत है और उन सबको एक्नॉलेज करने की जरूरत है, इनविजिबल नहीं रहने देने की जरूरत है।
थैंक यू श्वेता। मुझे लगता है अभी काफी समय हो गया है और हम इसे थोड़ा कंक्लूड की दिशा में जाए। सुबह से लेके जो सब लोगों ने बात रखी है उसमें सोशल प्रोटेक्शन का जो लैंडस्केप है वो लैंडस्केप समझने में हमारी सहायता हुई है सुबह से जो अलग अलग प्रेजेंटेशन थे उससे। एक है कि ये जो लैंडस्केप है बेसिकली अभी जो सोशल सिक्योरिटी या सोशल प्रोटेक्शन जो योजनाएं हैं वो टारगेटेड है। तो हम यूनिवर्सल सोशल सिक्योरिटी और सोशल प्रोटेक्शन की दिशा में कैसे जा सकते हैं, उसका लैंडस्केप उस दिशा में कैसे बढ़ा सकते हैं, वो एक बड़ा मुद्दा जो है हमारे सामने है। एक चैलेंज भी है और एक मुद्दा भी है। दूसरा जो है लैंडस्केप के संदर्भ में कि बेसिकली जो अलग अलग सेक्शंस है, खासकर वर्कर्स है, वीमेंस है, चिल्ड्रंस है, तो ये इनका एक अपने एक आइडेंटिटी के भी मुद्दे हैं और उनके अपने सोशो इकोनॉमिक और डेवलपमेंट के मुद्दे भी है। तो वो कॉन्टेक्स्ट में ओवरऑल सोशल सिक्योरिटी और सोशल प्रोटेक्शन का जो लैंडस्केप है वो कैसे बढ़ाए, अपनी सोच कैसे उस अंदर की सोच है या जो बेसिकली अप्रोच है पॉलिसी मेकिंग करते वक्त के जो मुद्दे हैं वो उसे हम किस तरह से आगे बढ़ा सकते हैं, वो भी एक बड़ा चैलेंज हमारे सामने है लैंडस्केप को देखते हुए उसके उस संदर्भ में काम करने के लिए। तीसरा महत्व का मुद्दा है कि कहीं ना कहीं ये सिटीजनशिप के साथ भी जुड़ा हुआ है कि जो सोशल प्रोटेक्शन और सोशल सिक्योरिटी का जो बेनिफिट है वो सिटीजनशिप के साथ जोड़ा गया है। और ये सोशल सिक्योरिटी और सोशल प्रोटेक्शन मतलब अगर सिटीजनशिप के आपके पास एंटाइटलमेंट नहीं है तो आप ये सोशल सिक्योरिटी और प्रोटेक्शन के बाहर हो। खासकर अर्बन क्षेत्र में या रूरल क्षेत्र में, दोनों जगह पे ये स्थिति है और वो काफी उसके लिए प्रयास करने पड़ते। तो वो जो लैंडस्केप है कि भाई सोशल प्रोटेक्शन ये सिटीजनशिप के साथ न जोड़ा जाए, उसको किस तरह से यूनिवर्सलाइज कर सकते हैं और एक ह्यूमन राइट्स फ्रेमवर्क में उसको दिया जा सकता है। तो ये सोशल प्रोटेक्शन का भी लैंडस्केप जो है ये जो मुद्दे है, ये मुद्दे के कॉन्टेक्स्ट में और हमको समझने की जरूरत है। और चौथा है पार्टिसिपेशन वाला जो मुद्दा है कि एक ये जो इसकी जो डिलीवरी करने का जो मैकेनिज्म और सिस्टम है, वो सिस्टम के साथ जब भी इस बेनिफिशियरी करके न देखते हुए उसको एक क्या बोलते हैं उसकी उसकी पार्टिसिपेशन की व्यवस्था कैसे विकसित हो सकती है गवर्नेंस मैकेनिज्म में, वो एक महत्वपूर्ण मुद्दा मुझे लगता है कि लैंडस्केप जब हमें सोशल सिक्योरिटी और प्रोटेक्शन का समझ रहे हैं तो ये अलग अलग एंगल से हमें अपना रीच बढ़ाने की जरूरत है। और काफी सारा डेटा आज दिन भर अलग अलग प्रेजेंटेशन के माध्यम से आया। दूसरा महत्व का मुद्दा है कि कन्वर्जन, और कन्वर्जन ये 3 स्तर का कन्वर्जेंस है। एक जो सरकार के स्तर पर जो अलग अलग डिपार्टमेंट है जो पॉलिसी फ्रेम करती है, स्कीम बनाती है, बजट अलोकेशन करती है, तो वो सभी डिपार्टमेंटों के बीच में कैसे कन्वर्जन होगा, उसका क्या मैकेनिज्म होगा, कौन प्रिंसिपली कौन सा प्रिंसिपल डिपार्टमेंट है कि जो वो कन्वर्जन करने के लिए इनिशिएटिव्स ले सकता है, उसके ऊपर प्रिंसिपल जिम्मेदारी हो सकती है। तो वो एक कन्वर्जन का इम्पोर्टेंट मुद्दा है। और दूसरा, और सब लोगों ने बात रखी है कि बेसिकली गवर्नमेंट और सिविल सोसाइटी के बीच में एक डायलॉग का स्पेस कैसे हो सकता है, कि वो किस तरह से वो स्पेस को हम क्रिएट कर सकते हैं ताकि जो भी एक इफेक्टिव सोशल प्रोटेक्शन के पॉलिसी भी बन सके और एग्जीक्यूशन भी हो सके। और कुछ अगर गैप्स है तो वो उस गैप्स फुलफिल करने के लिए एक मौका जो है, स्पेस जो है वो क्रिएट हो जाए। तीसरा है कि डिलीवरी ऑफ राइट्स, कि जब सोशल प्रोटेक्शन की डिलीवरी स्कीम के माध्यम से या अलग अलग बेनिफिट के माध्यम से जब होती है तो वो अमल करने की जो पूरी व्यवस्था है वो व्यवस्था अलग अलग डिपार्टमेंट के साथ जुड़ी हुई है। तो उसको किस तरह से कन्वर्ट किया जा सकता है, खासकर लोकल गवर्नेंस के लोकल गवर्नमेंट के फ्रेम में, ताकि एक ही जगह से सब चीजें हो और अच्छी तरह से उसका इम्प्लीमेंटेशन और मॉनिटरिंग हो सके। तो बेसिकली कन्वर्जन ये 3 स्तर पर देखने की जरूरत है। जो आज सुबह से जो मुद्दे आए वो मुद्दों के कॉन्टेक्स्ट में मैं यहाँ रख रहा हूँ। और तीसरा, जो इफेक्टिव स्ट्रेटेजीज के बारे में जो बात निकल कर आई है, वो एक बात निकल कर ये आई कि बहुत सारे जो जिनको सोशल प्रोटेक्शन की जरूरत है ऐसे ग्रुप इनविजिबल है, तो उसकी विजिबिलिटी कैसे बढ़ा सकते हैं और उसको सेंसस के साथ कैसे लिंक कर सकते हैं, क्योंकि जब तक आप सेंसस में वो डाटा को नहीं लाते तो गवर्नमेंट के प्लानिंग का जो पूरा मुद्दा है वो मुद्दे में उसको एड्रेस करना बहुत मुश्किल हो जाता है। तो वो ये इसके ऊपर एक इफेक्टिव रणनीति क्या हो सकती है, कि अलग अलग हो सकती है, उसकी रिसर्च हो सकता है कुछ बट इफेक्टिव स्ट्रेटेजी है कि गवर्नमेंट के सेंसस के प्रक्रिया में ये सब चीजें हम कैसे लाए। ये एक मुझे लगता है कि एक इम्पोर्टेंट मुद्दा है आगे बढ़ने के लिए। दूसरा है कि नरेटिव बिल्डिंग बहुत इम्पोर्टेंस है। कोई भी मुद्दा सामने आता है और उसके ऊपर जनमानस नहीं बनता है या पॉलिटिकल जो व्यू है वो व्यू ओपिनियन जनरेट करने में कामयाब नहीं होता है, तब तक वो पॉलिटिकल एजेंडा नहीं बनता है। तो नरेटिव बिल्ड करने के लिए भी क्या क्या चीजें हो सकती है उसके बारे में हमको सोचने की जरूरत है, जिससे रिसर्च अलग अलग तरह के रिसर्च हो सकते हैं, एक्शन रिसर्च हो सकते हैं, सोशल मीडिया का इस्तेमाल हो सकता है कैंपेन्स के माध्यम से, मीडिया के माध्यम से उसको पब्लिसिटीज देना, इस तरह के जो क्योंकि ये सब इंटरवेंशन से एक नरेटिव बिल्डिंग की प्रक्रिया को गति मिलती है और फिर वो पॉलिटिकल एजेंडा पे वो विषय आता है। तीसरा, और सब लोगों ने बोला ही है कि वो डायलॉग वाला जो है, बट कोहिलेशन बहुत इम्पोर्टेंस है कि हम बिटवीन सिविल सोसाइटी के बीच में और सिविल सोसाइटी और गवर्नमेंट के बीच में एक कोहिलेशंस किस तरह से बनाए जा सकते हैं और पॉलिसी फ्रेमिंग में और पॉलिसी मॉनिटरिंग में उसका किस तरह से इस्तेमाल किया जा सकता है, उसके उस संदर्भ में भी बहुत मतलब वो एक इफेक्टिव स्ट्रेटेजी हो सकती है। और चौथा जो मुद्दा है खासकर लीगल इंटरवेंशन, और लीगल इंटरवेंशन मतलब अगर इनविजिबिलिटी है, ह्यूमन राइट का वायलेशन हो रहा है, या जो पॉलिसी है लेकिन उसका एग्जीक्यूशन नहीं हो रहा है, तो लीगल इंटरवेंशन भी किस तरह से हो सकते हैं। कि एक उदाहरण के तौर पर ये जो पूरे माइग्रेंट का जो क्राइसिस था, तो जो राइट्स का जो वायलेशन हो रहा था, सोशल प्रोटेक्शन नहीं मिल रहा था, उस वक्त काफी सिविल सोसाइटी ग्रुप कोर्ट में गए, और कोर्ट में जाने के बाद सुप्रीम कोर्ट ने डायरेक्शंस दिए कि किस तरह से जो गवर्नमेंट को अपने सोशल प्रोटेक्शन का जो लैंडस्केप है बढ़ाना है, और जो इनविजिबल मुद्दे थे वो उसको विजिबल करने के लिए भी क्या एक्शंस लेना है। तो इस तरह के डायरेक्शंस कोर्ट ने भी दिए हैं। तो जो अभी जो ई श्रम वगैरह जो आया, वर्कर्स का जो रजिस्ट्रेशन हो रहा है, वही कोर्ट के इंटरवेंशन के कारण हो रहा है। और पेंडेमिक में भी माइग्रेंट वर्कर्स को काफी जो गवर्नमेंट के माध्यम से जो कुछ एक्शंस लिए गए उनको सोशल प्रोटेक्शन को पूरा करने के लिए, उसमें कोर्ट का, सुप्रीम कोर्ट का या हाई कोर्ट का काफी इम्पोर्टेंट रोल्स है। मुझे लगता है कि वो भी एक इफेक्टिव इंटरवेंशंस है। तो ऐसे काफी सारे इंटरवेंशंस है, तो मल्टीपल स्ट्रैटेजीज यूज हो सकते हैं। लेकिन जब हम गवर्नमेंट के साथ काम करते हैं तो उस वक्त का एक अलग लिमिटेशंस है, बट सिविल सोसाइटी भी अपने आप इकट्ठा होके काफी सारा चीज करती है, और करने का स्कोप भी है। तो ये थोड़ा कंक्लूजन करते हुए इन सब मुद्दों के साथ मैं ये जो अभी का जो सेशन है उसको समराइज करके रोशनी को दे रहा हूँ। थैंक यू।
Thank you so much, Raju, and thank you everyone. Just if you are leaving this week, 2 minutes, we'll just wind up.
Can't hear you, Roshni.
Can you hear me now?
Yes, yes.
Sorry. I won't even attempt to recap, the conversations, because I think there's a lot going on. Yeah. Okay. Thank you everyone for staying, and it's been very, very insightful, I think. And Marina and I were just looking at each other and thinking that, there's so much that we need to do, and the need is great, but the scope is equally great. And I'm really glad that we are all here together in that same sort of space. Just keeping the political context in mind, I think that's very important. The last session really brought that out. Ashwini Tai spoke about investments are decreasing. Many people, Abhay Shukla spoke about shrinking space for CSOs and so on. And this is a reality. We know this is happening. But I think really the question is for us, how do we move beyond this reality? How do we come together and really, in spite of this challenging political context, how can we move ahead? I think that's a challenge before us, and I think we're all ready to take on that challenge. And in that context, in that space, I think this idea of a platform such as this is what is really binding us together. Having both government as well as civil society, creating such a platform, and one which gets acknowledged, which is acknowledged as an experts group, which has a collective voice. And if we can find those common principles on which multiple stakeholders can come together, which meets regularly, I think, that really holds, it's going to be a torch for us as we move ahead in this space. Unfortunately, again, the government officials we invited today for different reasons couldn't join us. But I don't see that as, too much of an issue, because I think we have enough connections, enough leverage amongst this group today that we can definitely amplify our voice, by coming together and make sure that all the points that we are saying and speaking do reach the correct channels. And I think in this room, there's so much shared commitment to come together on a platform which is multi-stakeholder of this nature that I think that gives us all a lot of energy. Definitely people spoke about findings, recommendations from many of the evidence building activities. These will be so critical to influence, not just program design or targeting, but also actually the, implementation, ensuring, those nuanced ways of social protection can actually be achieved. So I think the evidence generation is a huge part of the picture. Similarly, the integrated framework, which Hyunhee so elegantly spoke of, I think even within this integrated framework, if we can in the near future identify priority areas, there's a lot to do, but if there are areas we'll have to decide collectively, is it migration, is it the urban question? I know different people have different interest areas as well, but how can we identify some priority areas which are then become pointers for us to move for that systemic and integrated framework? I think that is another way in which moving ahead. And I think what we intend to do going ahead is to really once again meet and have a larger discussion moving beyond the substantive issues to how will we work together, in this sort of a platform. I think that's an important next step for us, and we will definitely keep all of you in the loop on that and come together. And there are different thoughts. I know we've had individual bilateral conversations, but I think it'll be good for us to come together, see what are the ways and the structures and the ways in which modalities in which we work, and where are our priorities, what are the thematics that we will put in effort into. And we're really excited for that as well. And I think there's a lot of validation from today's conversation, and as well as so much learning. I agree with everybody on the chat who's really been talking about so much. We've all learned a lot, and there's still so much to do as well. Once again, thank you so much. Very sincerely, I'm sorry we went half an hour over time, and I really, really acknowledge everybody spending this time and staying here with us. And I think it just indicates how important this is for everyone, and it's just inspiring. I mean, all of you are so inspiring. I will not be able to personally thank everybody, but there have been so many people instrumental to putting this day together and really contributing with their time and their inputs. So thank you definitely to Anuradha and Kamini and the entire team. We are leaving feeling deeply energized, and the solidarity we've seen in this room. There's still nearly 50 people half an hour later. I think that's just really motivating, and we will be in touch. And thank you once again. And if you have any specific questions, please do feel free to reach out to us and be in touch. So once again, thanks, and yeah, bye. See you soon. We will be in touch.
Thanks, Roshni. Bye. Bye.
Thank you, everyone.
Thanks, Roshni, Marina, and people from UNICEF.
Roshni, I'm leaving now.